कोई ना कोई चीज में 2 दिन की ले लेता हूँ।
मुझे नहीं चाहिए।
वो अर्न लीव ऐसा नहीं है कि मतलब मेरी सोच थी तो सर मैं 6 बार में नहीं लेता, एक ही बार में मेरी फीस
Yeah, good evening and welcome everyone. I can see Renuka ma'am. Good evening, ma'am. Requesting my team to make Renuka ma'am co-host and all others will be joining. I can see Aruna ma'am also. And I think Professor Ved Prakash sir also has joined or not. Let me check. Aruna ma'am, just check whether you can unmute or not.
Yes, I can. You are muted, Renuka.
Please make Renuka ma'am also co-host.
Mrs. Govil, Professor Ved Prakash is also here.
Yeah, Professor Ved Prakash sir
Good
is also
afternoon, Chairman sir, Mr. Mundra.
Please make Hari Mundra sir as co-host. Good evening, sir, and welcome, please. Yeah, now you can try unmute, sir.
Yeah, you can hear now?
Yes, now you're audible, please. Welcome, sir.
But I think Renuka has gone on a silence mode.
Renuka ma'am is also co-host. She's had to just unmute. Professor Ved Prakash sir also requesting you to please switch on your video if you are, yeah. And Jyotsna ma'am,
Has she
Has she
come?
joined?
I cannot see her.
I don't see her.
Yeah, I think she's not yet logged.
Aruna, you got the perfect backdrop.
Yeah, good evening and welcome, Professor Ved Prakash sir. You can just test whether you can unmute or not.
Good evening. Good evening to everyone.
Professor Prakash sir, we have Hari Mundra sir, who is chairman of Indian Cancer Society overall. And for the Delhi branch, we have Josna Govil ma'am. So, Hari Mundra sir, we have Professor Prakash sir, he is former chairman UGC.
Yeah, I see.
Yeah.
Welcome, sir.
Good evening, Professor Harimundra ji.
You
Good evening.
No, you must have been one of the architects of the new education policy of 2020.
I made a little contribution actually, but the policy was announced much later.
Acha.
I left in 2017.
Okay.
We had started the initial work in 2014. So the government took 6 long years to finalize the national education policy, which was formally released in July 2020.
But prior to that, sir has rich expertise. Almost for 15 years, he had into various top 3 positions, secretary, vice chairman, and then chairman at UGC. So it's a long contribution. I think it's a unique one. No one else has the privilege of having all the 3 positions, sir, as per my information.
It was a matter of chance, I think.
I think Josna ma'am also has joined. Let me just, requesting ma'am to please switch on her video and we can.
Hi, good evening, everybody.
Yeah, good evening,
Hi,
ma'am.
Josna. Welcome
Hello.
back. Welcome back.
Thank you.
Yeah.
Professor
Good evening, ma'am.
Ved Prakash, namaskar.
Jyotna ji, namaskar.
I renew my acquaintanceship with you year after year.
Yeah.
I was today only discussing with sir and now we should plan a offline meeting also where
Yes.
because virtually we have been interacting. Yeah, so we'll do it very soon. Yeah.
Absolutely. Let's do that.
So, Aruna ma'am, is the quorum complete or are we awaiting? Dr. Monica, has she joined? Ma'am, you are on mute, Aruna ma'am.
She'll join at 4:15, probably another 7 minutes. You can carry on.
Okay, so I think we can start then with your permission. Renuka ma'am is saying something. I think ma'am is on mute.
It's also muted. Renu.
Ma'am, towards the extreme left, there is a audio button. You have to just press on it. Towards the extreme left of the screen. Bottom side.
Down below.
Down below, yeah. Not on that.
Okay. Yeah, that's better. Thank you. So good evening, everyone. Yeah, right. Okay.
Thank you. So, Josna ma'am, may I start then?
Please do. Please do.
So, let me just share my screen. So, I'm Vimal Rar and it's my absolute pleasure to extend a hearty welcome to each one of you present here in this 1-week National Online Faculty Development Program on Cancer Awareness, jointly conducted by UGC Malviya Mission Teacher Training Center in collaboration with Indian Cancer Society, Delhi, and the technical support of My Class Academy on behalf of Vidyavani Foundation. I welcome each one of you on behalf of UGC Malviya Mission Teacher Training Center, a center of Ministry of Education, Government of India, and University Grants Commission under the entire flagship program at the national level, which is Malviya Mission Teacher Training Program. The center is situated at my own premier institution, Shri Guru Tegh Bahadur Khalsa College, a constituent college of University of Delhi. So I extend warm welcome on behalf of my institution and University of Delhi as well. And as we begin starting this new program, which is very important for building up a better society, we seek blessings from Guru Angad Dev Ji, the second of the 10 Sikh Gurus, on whose name we are taking this center further and working for the capacity building of the teachers in various fronts. And at the central level, the scheme has been named in the honor of Bharat Ratna Pandit Madan Mohan Malviya ji. So remembering him also, we take it further. I welcome each one of you. Especially we have Mr. Hari Mundra sir, Chairman of Indian Cancer Society. We have Jyotsna Govil ma'am, who is the Chairperson ICS Delhi. We have Professor Ved Prakash sir, who is former Chairman University Grants Commission, and also the Chairman of Vidyavani Foundation, who is also the supporting partner for this FDP. I also extend my welcome to Ma'am Renuka Prasad ma'am, Dr. Monica Arora, who will be giving the keynote address, Dr. Soumya, Aruna Umat ma'am, and all others from the ICS team who have taken pain in designing and will be delivering this program in collaboration with us. So the team, the core team at Indian Cancer Society, as I mentioned, Mr. Hari Mundra sir, Mrs. Usha Thorat, Mrs. Jyotsna Govil, Mrs. Renuka Prasad, and Mrs. Aruna Ummat. Along with various speakers, I convey my thanks to the entire team of experts and speakers from Indian Cancer Society. And I also extend gratitude to my own core team at UGC Malviya Mission Teacher Training Center, which has been working now almost since 2016. And we have trained more than 98,000 teachers across the country. And I pay my gratitude to Padma Bhushan Sardar Lochan Singh sir, who is the chairman of governing body at SGTB Khalsa College. Very warm welcome to Professor Ved Prakash sir, and thanks for mentoring us at this center, sir. I also convey my thanks to Professor A.K. Bakshi sir and Professor Jaswinder Singh sir, who are again our mentors. And as executive heads at this center, I, Vimal Rar, along with Professor Gurmohinder Singh, who is the principal SCTB Khalsa College, he has recently taken this position. So I convey thanks to him also for extending support to this center to take the activities on day to day. So with these words, and I specially welcome to all our colleagues who have joined as participants in this 1 week long program, which will be extended to almost 2 weeks spreaded. We'll be sharing the details there with you, but then it will be required for the compliance of the overall duration, which is required for the FTP. So let us join our hands to seek blessing of the gods. UGC Malviya Mission Teacher Training Center is a new name given. Prior to this, we were known as Teaching Learning Center under the Pandit Madan Mohan Malviya Nation Mission on Teacher and Teaching Scheme. And since September 2023, now all the UGC HRDCs and the PMMT centers are renamed as Malviya Mission Teacher Training Centers. And the aim of this new phase is to build competencies in the faculty for better teaching, learning, and research by exposing them to Indian values, updating knowledge and skills, and aligning teaching, learning, and research with the needs of the society and NEP 2020. And when we say the needs of the society, which program better than this on cancer awareness will do that role? National education policy talks about the flexibility, mobility, and how the equivalence between general education, vocational education, with the provision of multiple entry and multiple exit. It also talks about that how the higher education will be embedding the components of project work, activities, community building, and the involvement with NGOs. So now we have the detailed SOP where the learning hours for earning credits will no longer be around the curricular areas, but also the co-curricular and extracurricular activities. And let me briefly tell you that based on this policy, universities are now restructuring the undergraduate program as a 4-year program by designing curriculum where there will be due weightage of participation of students in various activities, projects, community outreach every year. There is a need to provide hand-holding of teachers in different areas by the industry as well as NGOs, especially for community outreach program. And additional activities like community-based activities, career counseling, tutorials may also be creditized. This is now clearly written in the standard operating procedures which have been issued. So with this idea that how we can take one particular theme, and at our center we are working on various themes, but when we talk about the cancer awareness, who better than Indian Cancer Society? And I am so thankful to the entire team of ICS, especially Josna ma'am, to give us opportunity to work for this community requirement, and also through the higher education institutions, giving opportunity to the teachers to get involved, get aware, and also with the help of students, they can take this really to the grassroots level, which is required. There will be different completion parameters for this FDP, like attendance, the conduct of one seminar, quiz assignment. We'll be telling you about the details of this. But most importantly, there will be a provision for the phase 2. And it is expected that all of you will be taking the phase 2, where you can act as mentor to your 5 to 10 or 15. We'll like it to have in a group of 5. And guided activities, what all has to be done will be there throughout this particular implementation. And on successful completion, each teacher will be given mentor certificate for mentoring whatever number of students they have enrolled. And the students will also get an internship certificate in the community outreach program for a period of 3 months by Indian Cancer Society. And this phase 2 can be completed by April 2025. And all the support material along with the recorded videos here, there are also pre-recorded video. We have jointly conducted one program, which is a very successful with more than 15,000 registration, and it is still ongoing on the SWAM platform about the cancer fundamentals. And again, thanks to Josna ma'am that in the last meeting we agreed best performers will be awarded certificate of appreciation by ICS for participation in the community-based service. And we will be ready to sign MOAs. Especially, I'm looking forward to the teachers who are coming from autonomous institutions who can make their decisions. So if you want to convert this very particular program into a credit program, we will be customizing it as per your needs, and we will like to take it further in this. So there is a provision now as per the last week's notification of the standard operating procedures that how higher education institutions can integrate all this. So with these words, I welcome each one of you again in this 1-week National Online Faculty Development Program on cancer. And this FDP, I am sure, will act as a model of experiential learning to help the teachers build 21st century skills as well. Because when the students work in group, it's not just that particular theme getting work, but they also interact with each other, they interact with others. So when the field activities are done, when they present in front of teachers, communication skills, the digital, so many skills they are getting nurtured. And all this is also will be helping in the NEP 2020 vision and the outcome-based education. So these FDPs will also help institutions to work towards the goal of community outreach as required for the NAC and other accreditations. And now I will request Mrs. Aruna Umat ma'am, Honorable Joint Secretary Awareness and Training at Indian Cancer Society, to take the proceeding further. But before that, very briefly, I would like to introduce her. Mrs. Aruna Umat had been in the field of education both at college and school level. for more than 40 years, and her study discipline has been physics. Soon after her retirement as principal of a reputed school in Delhi, she joined Indian Cancer Society, Delhi, in 2012 to engage her mind meaningfully and contribute to community welfare. And she is presently the Joint Director, Awareness and Training, and is also the coordinator of the Faculty Development Program. And personally, I have interacted and see how meticulously she does the planning, going into the minute details of designing the flow of the program and everything. So over to you, ma'am. Welcome, please.
Thank you, Vimal, but I don't see Monica Arora right now. Are you there, Monica?
Can we just check? Otherwise, we can then, yeah.
I think we'll have to.
I think Dr. Monica Biotech CBL.
No.
Two Monicas are there. Can you just text us if you're there, ma'am, in the chat? Or Aruna, ma'am, can you coordinate? Otherwise, yeah.
Let me check if she's there. Otherwise, we carry on with the next.
Dr. Monica Biotech, I can see. If she's the same person, then we can.
This is Monica Arora.
Monica Arora.
I'll just check.
Yeah, she's the one. Requesting my team to make her as co-host, please. So that one is different. Monica Arora has joined. Requesting ma'am to please unmute and Monica Arora, ma'am.
Hang on, let's just check.
Yeah.
I don't think she's there right now. You carry on with the next.
Yeah.
Can you speak to
1 second. Vimal, she says she's unable to enter.
Yeah, I am here now.
Okay,
Okay,
great.
ma'am, it's there. Yeah.
Okay.
Yeah, so I think we can.
She's joined?
Yeah, go ahead.
Okay. Hello, hello, Dr. Monica.
Hello, ma'am. How are you?
Good. Thank you. Good afternoon, everyone. It's my privilege to welcome Dr. Monica Arora, the keynote speaker of the day. Ladies and gentlemen, let me introduce her to you very briefly. Professor Monica Arora is a public health scientist working in the area of non-communicable disease prevention and control and child and adolescent health. She is Vice President, Research and Health Promotion at the Public Health Foundation of India. She is also the Executive Director of HRIDE. The full form of it is Health-Related Information Dissemination Amongst Youth, an NGO working on meaningful engagement of adolescents and people with lived experiences. HRIDE houses the Secretariat of Healthy India Alliance. She is the president of the NCD Alliance 2023-25. Professor Arora is a member of various expert committees formed by the Ministry of Health and Family Welfare, Government of India on non-communicable diseases, adolescent health, and tobacco control. Professor Arora was a member of the first and second WHO Civil Society Working Group on NCD, formed by the WHO Director General for the term 2018 to 2021. Dr. Arora has been awarded the Best Practices Award in Global Health in 2011 by the prestigious Global Health Council, WHO Director General's World No Tobacco Day Award in 2012, and Best Practices Award in Global Health in 2011 by the prestigious Global Health Council. Welcome, Dr. Arora. On to you. Thank you.
Thank you so much, ma'am, for that kind introduction. I feel very embarrassed hearing that kind of introduction with such august gathering. I know all of you are much more accomplished than these credits that have been read out. So good evening, everyone. And before I begin, I would like to thank Indian Cancer Society for giving me the pleasure to address you all today. Very hearty congratulations to India Cancer Society on completing 3 years running the faculty development program and reaching to 21 states of India. I am confident these groundbreaking strides towards cancer awareness and ultimately prevention have touched the lives of countless communities. As a public health professional, and amongst you would be many medical professionals, we all have witnessed the low health literacy rates when it comes to cancer. Although much work is being done to drive awareness and eliminate inequity, research has very clearly shown that health literacy as the most frequently reported barrier, regardless of the type of cancer, even more than limited access to diagnostics. So that underscores the very important role that Indian Cancer Society is playing by running this faculty development intervention. Also, the most disadvantaged groups in low and middle income countries have been known to suffer disproportionately from inequitable healthcare access and cancer illiteracy, leading to late diagnosis, poor prognosis, so requiring targeted programs like these being led by ICS, which addresses not only health literacy and cancer stigma, but also is a way to engage communities. And I'll talk a bit more about why it is so important to engage communities through most of you who are in a role where you can change the outlook and understanding of the disease. Also, evidence continues to highlight the importance of cultural competence, trust building, and meaningful collaboration between stakeholders, including community leaders, healthcare providers, researchers, and policymakers. And some of our work currently is around even engaging what we call traditional healers. And the problem with cancer has been that people do not want to access health system because somebody would have told them that they go to a traditional healer and it will completely be cured. So working with these barriers is also important, where we have seen that working with traditional healers, telling them that don't keep such cases with you and please refer them to the health system is equally important, because we all understand that they are a stakeholder in the community. They at times are decision makers, and engaging with them is important. But to be able to involve them in a meaningful way and to be able to drive people to the right pathways. Also, investigating factors which are contributing to these disparities. Some common themes arise: socioeconomic factors, racial, ethnic disparities, behavioral factors. We have been doing a lot of work with ICS on preventing tobacco use, improving physical activity, poor nutrition, low adherence to recommended cancer screenings. These have all been found to contribute to disparities in cancer incidences and outcomes. So as I mentioned, currently a lot of work is being done on community engagement, and most of these barriers can be very effectively handled with effective community engagement, as sustainable and impactful solutions come through them. So you are an important contributor in ensuring that sustainable interventions can be led, implemented, evaluated, and sustained. Also recognizing that communities are experts in their own experience. Their needs, preferences have to be taken into account when designing interventions or even national programming. As a practice, it empowers them to participate in decision-making processes actively. Another incident I would like to highlight, since this few days you will be discussing a lot of issues But ground reality is if a family member is diagnosed with cancer, we were told that the patient is not informed about his or her condition because they feel that if the person is informed, they will get scared and they will not respond to treatment, whereas it is the other way around. Taking the patient into confidence, ensuring they participate in their treatment and decision making is what has been shown to improve health outcomes. So this agency of patient and patient being seen in the last hierarchy in the health system to be on the lowest ladder is something which is very, very worrying and needs to be changed. So some of the current ongoing work at various Healthy India Alliance, which is the India NCD Alliance, is also focusing on meaningful patient engagement. The National Program on NCD has now categorically written in the policy document how meaningfully patients can be engaged in their prevention and management of diseases. So when it comes to prevention, India has excellent examples of school interventions because we all know all the risk factors we talked about which contribute to cancers, and NCDs get etched at a very early age, whether it is tobacco use or it is alcohol use or unhealthy nutrition. So these interventions, when provided by teachers in school settings, have been shown in many interventions to bring about behavior change and motivating these children from young age to be able to adopt healthy lifestyles and make choices which are health promoting. Similarly, in the higher education institution settings, these examples have been shown to be effective where it is meaningfully engaging the youth themselves to design such interventions and making their universities tobacco-free, making their colleges health promoting, so that way ensuring the nutrition and physical activity levels as well as substance abuse are taken care of. So these results, not only in India, but globally, have been shown that they improve knowledge about different cancer topics. They significantly increase the participation in prevention and treatment programs. Trained teachers from here can work with students to produce and deliver impactful cancer prevention campaigns, not only in their institution setting, but in the community as well, and also improve the health behaviors in the family. So they can be the bearers of these messages back to the family. So this clearly further points to the fact that schools, universities, communities are effective health promoting settings when it comes for cancer related knowledge, awareness, changing attitudes and practices. Recently, I had the privilege to co-edit a publication which is Public Health Approaches to Health Promotion. And this has 2 chapters dedicated on India's cancer prevention and treatment case studies and what lessons have been learned. So we have been hearing a lot of health promotion interventions from Western countries, but those are very high cost. Whereas in India and South Asia, we have excellent examples of working on shoestring budgets and bringing about big impact when it comes to public health interventions. So this particular monograph has been written, edited by mostly Indians. We only have commentaries by foreign authors, but mostly it is Indians and South Asian authors who have contributed to this publication. So I would encourage, as the teachers develop their interventions with the students or the projects they may want to develop, they can look at this publication as well, and I'll be happy to send link to ICS. Finally, I would lastly want to conclude my address by saying that ongoing community engagement efforts is a flagship program of the Global NCD Alliance, of which I am currently serving as the president. of the India NCD Alliance, and also a Southeast Asia NCD Alliance conference is coming up later in August, which has a very important agenda of meaningfully engaging people with lived experience. So developing these models, evidence-based health promotion interventions with the community is an important area of work, and you would be the flag bearers after you graduate from this training program. So I would just end by again thanking Indian Cancer Society for inviting me and for giving me an opportunity to speak with all of you. Thank you.
Thank you, Dr. Arora, for such an insightful address. You rightly said that youth and community engagement in spreading awareness is an effective way to cancer control. We are honored to have you as our main guest speaker. Thank you very much. On to you, Professor Vimal.
Thank you, Aruna ma'am, and thank you, Professor Monica Arora, for highlighting the significance of that, how schools and higher education, they can play important role in spreading this very important awareness. And especially when you meant that the patient is at the starting of the ladder, I think that is really needs to be worked, because when you are educated, then in that education, this also should be very important part, and how you can mentally, psychologically, and also take the family along in this particular scenario is very important. And I'm sure this is very important takeaway for all our participants to go ahead along with other comments. And now I will invite Professor Ved Prakash sir, who is former chairman UGC. And before I do that, very briefly, I would like to introduce, although he is again, he doesn't need any introduction, but for the sake of new participants and also a motivation for them to take it further. So Professor Ved Prakash is a distinguished name in Indian academia and has the unique distinction of spearheading the University Grants Commission, the apex regulator of higher education in India, as its chairman, vice chairman, and secretary for almost 15 long years. Under his stewardship, UGC made significant strides in the areas of curricular reform, internationalization, basic scientific research, skill education, gender and social equity in higher education, BVOC and MVOC program, even the community programs in institutions. He has to his credit to transformation of National Institute of Educational Planning and Administration, that is NIPA, into a university, where he also served as its founder vice chancellor. In his stellar career of more than 48 years, he had made seminal contribution as advisor education in the Planning Commission of India, chairman of National Council for Teacher Education, professor and head NCRT, joint director Staff Selection Commission, to name a few. A US Fulbright scholar, Professor Ved Prakash has been a visiting faculty at University of Windsor, Canada, a guest faculty at HIID, Harvard University, and consultant to the World Bank. He has published extensively on a wide spectrum of areas concerning school education, higher education, and educational planning and administration. And at Vidyavani Foundation, he is committed towards working for rural students, guiding them for their early goal settings, and hand-holding teachers for the newer challenges through the various capacity building programs. And no doubt he has been conferred with many coveted awards and honors for his contribution in the field of education. So welcome once again, sir, and over to you, please.
Thank you very much, Professor Vimal. I think I have unmuted. Am I audible?
Yes, sir, you are audible.
Respected Professor Jyotsna Govilji, esteemed Shri Hari Mundra ji, Aruna ji, Renuka ji, Professor Vimal, and all the distinguished members of the Indian Cancer Society and the participants of this faculty development program. I'm extremely grateful to Professor Vimal and Jyotsna Govilji and the entire team of the Indian Cancer Society for giving me this opportunity to be a part of this faculty development program. it's indeed heartening to note that the Delhi branch of the Indian Cancer Society, in collaboration with the Vidyavani Foundation, is harnessing the power of teachers and students as voice multipliers for cancer control and cancer prevention. The main point which has been highlighted now by Professor Monica Arora ji. We all know that cancer is a pervasive health challenge which affects millions worldwide. And being a global health challenge, it affects not only individuals, but also communities. And which is why it is extremely important to create awareness amongst the communities about its consequences. And I'm of the opinion that if we equip teachers with the correct information about cancer, its risk factors, prevention strategies, and available support system that we have, they can guide their students to follow a proactive approach to their health, as also to the health of their families. As educators and role models, faculty members have a unique opportunity to empower students with knowledge that extends beyond the boundaries of the textbooks. Equipping the university and college faculty with accurate, up-to-date information about cancer types, risk factors, preventive measures, and support system is highly a worthwhile endeavor. And that is what is being done under the stewardship of Madam Jyotsna ji and Hari Mudra ji and their team members. And therefore, integrating cancer awareness as a module in the faculty development program is a very transformative step towards building a more socially conscious and empowered community. Faculty members are influential role models for students. And by integrating cancer awareness discussions into various subjects, teachers can foster open dialogue about health, dispel myths, and encourage students to follow a proactive approach. Cancer awareness is not limited to medical sciences, actually. It is a very integrated discipline. And a day before yesterday, I was giving a lecture and I was telling that when we were growing, I was taught chemistry. I was taught the periodic table in chemistry like a chart. I was never ever told how it is related with the life sciences, how it is related with physical sciences, and how it is related with mathematics. Similarly, photosynthesis, we were taught as if it is only a biological process, which it is not. There is a technology involved in it. There is a physics involved in it. And there is a geography involved in it. And therefore, the point that I would like to make here is that if we can integrate the cancer awareness issues along with the existing curricular provisions in sciences, in humanities, and in social sciences, in business management, I think we can do a great service to the society. And the cross-disciplinary approach, which will enrich students' understanding of real complex world problems, that is what is underlined in the National Education Policy 2020. There's a growing demand now for integrating humanities and arts and science and technology, because people are saying that the new knowledge lies at the intersections of different disciplines. And I was just going through the biodata of the recent Nobel laureates, and I found out, to my great surprise, that majority of the Nobel laureates in the last 2 decades are those who have defied the a particular discipline. They are the people who are from different disciplines. And therefore, I would strongly advise integrating cancer awareness into undergraduate programs. Such an initiative can surely contribute to public health education and empower students with knowledge about its early detection, healthy behaviors, besides fostering research and innovation. We may encourage student-led initiatives such as awareness campaign, fundraising events, and support groups. We may also train students to become peer educators who can disseminate information across the institutions. It will help students gain a deeper understanding of cancer, which can be applied in various professional fields. It will help individuals make informed health choices and engage in preventive measures. Besides, exposure to cancer-related topics can open career path in healthcare, research, and public health advocacy. These are the high opportunity program in today's time. And most of the leading institutions are coming up with these high opportunity programs. They are not neglecting the basic disciplines like language, humanities, and social sciences, but keeping in view the demands of the modern world, they are coming up with high opportunity programs in healthcare and community health and public health advocacy. We need to learn a great deal from the leading institutions of the world insofar as these high opportunity programs are concerned. By embedding this important subject like cancer into the curriculum and providing practical experiences, institutions can contribute to a more informed and health-conscious society. Education is not all about transmitting facts. Education is about nurturing well-rounded individuals who contribute positively to the society, and including cancer awareness in the curriculum emphasizes social responsibility, compassion, and the value of knowledge for the greater good. Faculty members, I'm of the opinion, can become catalysts for positive change in the communities. Cancer, which is often shrouded in myths and stigma, needs to be discussed openly. Faculty members armed with accurate information can address the misconceptions, the kind of misconceptions which Professor Monica Arora was talking about a little while ago, normalize the discussions about cancer and break down barriers that hinder timely diagnosis and treatment seeking. Introducing cancer awareness as a module foster collaboration among faculty members. And we can take help of the doctors working in different institutions. We can organize lectures, we can have invited talks, we can organize the brainstorming sessions. These are some of the innovative ways to integrate the topic into their subject, share resources, and collectively create a supportive network dedicated to empowering students with critical health information. It is about cultivating a community that cares, shares, and actively contributes to the well-being of its member. That is what is needed. And under such initiative, I think one can provide the recipients with resources, insights, and training that will enhance their understanding of cancer and enable them to effectively disseminate this knowledge to students as also to the communities. A program like this can enrich our understanding of different types of cancers, their prevalence, and the latest advancements in cancer research. There is a common knowledge that most cancers can be prevented by following a healthy lifestyle. But the irony is that this common knowledge, which is so simple, doesn't reach the common man. If we create simple awareness about cancer, like avoid smoking, maintain a healthy weight, exercise regularly, eat a healthy diet, and protect from the UVs, get screening tests regularly done, we can save many lives on this planet. So let us embark on this journey of education, empathy, and transformation together under the stewardship of the illustrious leaders like Professor Hari Mundraji, Jyotsnaji, and other team members. Let us try to make the most out of this initiative, which is jointly launched by Jyotsnaji and Professor Vimal under the aegis of the Indian Cancer Society. I will close by once again, thanking the Indian Cancer Society for giving me this opportunity. And I would like to share with all the esteemed members of the Indian Cancer Society that wherever I go for delivering talks in the universities and colleges, I am these days focusing more on integrated teaching and learning, wherein I emphasize that the time has come when we need to dissolve the boundaries between the disciplines that we had created when we embraced the Humboldtian model in late 18th and early 19th century. That was different kind of an era, but now we have entered into an era when we need to dissolve the boundaries so that the students can assimilate the knowledge from across the disciplines. And this is how they can be the leaders to address the real world complex issues which the world is facing today. So thank you very much, Professor Mundraji and Professor Jyotsnaji and Professor Vimal for giving me this opportunity to share in brief, very simple thoughts with the members of this faculty development program. Over to you, and thank you very much.
Thank you so much, sir. And especially that how national education policy is looking for preparing our students in the generic learning outcomes. And you rightly said that how this theme can be actually taken as a group project activity into developing their other skills which are lacking because of the more rote learning type of attitude that we have taken. So I think this way, this FDP will be also helping teachers to come out with ideas which they can extend into other themes also, that if we want to involve the students into project activities and others like field activities, so how proper documentation we'll have placeholders as templates where the geotag photographs and all they will be putting, and all information will be collected on the virtual platform, which is My Class. And there will be hand-holding of the students as well as teachers with the videos which are prior recorded. And I recall the journey which we have taken with Jyotsna ma'am and the entire ICS team. I think it's like more than 8 years, ma'am, when we started the recording of the cancer awareness program for the SWAM portal, where we have more than 15,000 plus enrollments. And during the Corona time, we figured out that, yes, can we use this technology model to have the hand-holding, because as individuals, you cannot conduct the program so often in face-to-face mode, costing and so many things. But then with the virtual mode, so here comes the online FDP with a phase 2, where all the teachers will be then doing the face-to-face field activities and various other things that we have compiled, and we'll be sharing details with them, going to the hospitals, creating posters, and then taking them into mobile apps. So we have a very beautiful mobile app of Indian Cancer Society, and there can be analysis on that. Also, I recall we have worked together for Hindi, Punjabi, and so many languages. And in our earlier FDPs, now this is the third year we are doing this program, and I'm happy to see that many of the teachers coming from regional languages, they have volunteered to translate the existing content of Indian Cancer Society. So it's a sky of opportunities for all of you. All of you are creative. I am talking about all the participants who are colleagues from different parts of our lovely country, India, who can get idea after attending this FDP that now how it can be really taken further. And now you also can be working directly with the ICS. Like I also now claim to have become a volunteer with ICS. I feel a part of the family when I enter into the premises of Indian Cancer Society. So thank you, ma'am. And with these words, I will like to invite Jyotsna ma'am for...
Yes, can I make a very brief submission?
Yes, please, sir.
It was in 1991 when a public interest litigation was filed in the Supreme Court about the environment education. And as a result of which the Supreme Court had given the direction that it should be taught as a compulsory subject at the undergraduate level. I'm not saying that, but what I propose to do is that if we prepare a small handout and share it with all the leaders of the higher educational institutions, because most of them are in the process of revisiting their existing curricular provisions. And if we request them that if it could be integrated as one of the modules or as one of the units or a small topic, I mean, at the undergraduate level, cutting across different domains of knowledge. I think that is a doable proposition and people would like to do it. I think we need to tell about the consequences of this deadly disease and then tell them that how it can be prevented, provided we take some such simple steps. So I would, I mean, earnestly request Harimudra ji and Jyotsna ji and Aruna ji, I mean, to take note of this if we can do something like this. Thank you very much.
I think that's a wonderful idea, sir. And in the light of NEP and these SOPs which have been released just last week, now there's a provision of that even the credit can be given for the community-based courses. So some meaningful structure can be taken, and I'll definitely speak to Jyotsna ma'am and team for taking that in a and take your guidance, sir, to make it reach to the
If
other.
it can be undertaken as a project, because the project is going to be one of the major activities at the undergraduate program in a 4-year undergraduate degree program now. Right. Thank you. Thank you very much once again.
And before I invite Jyotsna ma'am, let me briefly introduce her. Again, she's a figure of which I think even in our education community, ma'am, you are so well known, and there are repeat participants from the same institution. Other colleagues have joined and who have that, yes, we like to interact with the entire team headed by Jyotsna ma'am. So, Mrs. Jyotsna Govil, ma'am, has joined Indian Cancer Society in 1985 as a volunteer, and she is presently the chairperson of ICS Delhi since 2016. During all these years, she mentored a whole generation of awareness speakers and hospital volunteers, and she introduced innovative ideas such as information leaflets, radio talks as voice multiplier, etc. Mrs. Govil is a member of many reputed national and international organizations. And to name a few, she is the founder member of APAC HPV consultation and represents India on the board. She is also the founder member of Healthy India Alliance and has been member of Global Advisory Committee of the Our Views, Our Voices initiative of the International NCT Alliance. Mrs. Govil has received many awards like Paul Harris Fellow, Rotary Club, Lifetime Achievement Award for long years of dedication to cancer control by We Care Foundation and WHO Regional Directors Appreciation for contribution to public education on hazards of tobacco use and many more. And she has presented papers at various international and national conferences. And what I see is the all motherly figure when we reach to the institution, such so caring and such a warm personality. It's really you motivate me to work for this particular cause. So I'm so thankful to have put me. Otherwise, I'm a chemistry, a very dry person, I will say, not at all into these. But it's really eye-opening thing for me that we all have the responsibility of contributing to make our society a better. And what better can be done through our teachers, because all the students who are getting nurtured in our classroom will be ultimately the part of the society. So over to you, ma'am.
Thank you, Vimal. I was beginning to get very impressed with myself. I'm no boffin. I just think that, like Ved Prakash ji said, science and humanity, not humanities, humanity need to integrate for society to move forward. That has been our effort all these years at Indian Cancer Society. Education for me is the bedrock of the nation. If we do not have proper education, proper teaching, we will forever be a second-rate nation. we have to introduce quality. We have to introduce new thinking. And we have to introduce a can-do attitude among ourselves first, and then among all the children whom we come in contact with. I've written something which I can't read because my eyesight is so bad, so you'll excuse me if I speak extempore. Why cancer? As Ved Prakash ji has already said, it is one of the diseases, and I won't use the word dreaded because I don't think we dread it any longer. We have the means to defeat it if only we would apply our minds to it. And instead of finding excuses for not doing something, not using the technologies which are available, that we learn about them and humanize them so that people are not afraid of a vaccine or of any new form of treatment. So the faculty that we have at ICS don't carry the title of professor or doctor among them. We're all plain and simple women. My predecessor in the chair used to say just ordinary housewives. He's right. We were ordinary housewives who have risen above the ordinary portion of their lives and come back to do something. They are schooled in the highest and toughest school anywhere in the world. They are all cancer survivors or they are cancer caregivers. And nothing can be better than someone with a lived experience to explain what cancer is about. Because it's not just about facts and figures. We can all reel off many figures to you. We can talk about all the various hundreds of cancers. We were afraid of one coronavirus. Just think of how many cancers exist of every part of our human body. Just think of how many viruses exist in the one human papilloma virus. How many strains? So there's nothing to be afraid of, but certainly there is a great need to overcome. And this is not a dreaded disease. This is a very tough disease because it has existed from the time of the pharaohs that we know of. I mean, I'm talking of documented history. And if we go back into our Shastras, we know that it was then also. It has survived every form of treatment. Modern treatment, what we call modern treatment of what Dr. Jasawala used to say was slash, burn, and poison, that is surgery, radiation, and chemotherapy, it has survived that. It no longer responds that well to those therapies. Now there are new therapies of immunotherapy, of genomics, of new targeted therapies. We are constantly learning. We are constantly moving. We cannot stand still if we are ever to even combat this disease, never mind overcome it. So my appeal to all the teachers, you are the makers of modern India. You are the people who are dealing with youngsters all the time. And we have tried to create a curriculum which combines the scientific facts, the economics of cancer, because it is certainly not a cheap disease. And also we have given you all the various modalities that are required in the treatment of cancer. It's not just medicine. It is not just a shot once a week or once a month or whatever. It is hand-holding right through the process and a continuing commitment to defeat the disease. I think Professor Ved Prakash, I loved his comments that new knowledge is at the intersection of different disciplines. You're so right, Professor Ved Prakash. I think that is where we want to move forward. I want to thank Vimal. She came in like a breath of fresh air really into our office and gave us new opportunities. Vimal, we seize them every time. She talked about the Swayam platform, which frankly I had never heard of. So we worked on it during COVID when everyone else was shutting down. We worked on the new cancer fundamentals, and the doctors, the oncologists, busy people who suddenly had time on their hands were so happy to help us. I think we had about 25 or more senior oncologists around Delhi who joined hands with us to give us a really good program. And as Vimal has already told you, at any time we have about 15,000 students. They complete the course, they leave, they come back, they tell us what they want to do. So it's very encouraging for us to do a program like that. Then we came to the FDP, which is another challenge, another exciting challenge, because we are dealing with educated, thinking people. And I hope they found it a challenge too, working with people like us who don't have academic qualifications, although some of us do. We've got many volunteers with very good academic qualifications, but the rest of us who only come, as somebody said, with more heart than head. So thank you, Vimal. Thank you, the faculty from all the various universities. Thank you, Dr. Ved Prakash. I really appreciate your continuing association with us. Thank you and God bless you all.
Thank you so much, ma'am. And I can see it's not just the leadership qualities in ma'am, but in every meeting, ma'am was there to guide us and take even notes that this is missing, this is to be done. So thank you, ma'am, for taking this, and really we get motivation to work more at your age, like and we have stalwarts here, same way with the Renuka ma'am. When you are away, then she's there to take the things further. So really heartening to meet a group like at ICS Delhi. So as I told, as a chemistry person, it's a real change that you have brought. And now I think about how other issues can also be brought up with this type of model, where we give the theme from 1 week or 2 week FDP type of arrangement, and then the teachers take the baton further in their classroom with their students and go and really perform that particular activity which is desired to take the real vision further. And I'm sure this will be a motivation for all the participants who have joined here, who will be really taking. See, this time, let me make it very clear, this particular FDP is even more challenging because of the new guidelines with no registration costs and all. And thanks to Josna ma'am for all that support also, and all the sponsors who are in turn giving the support to the ICS. And we look forward to more because when we take it in this 2-3 level, it's really a long work. It's not like the routine FDPs that 1 week and go. So throughout the year, the ICS team and the entire
Connectivity.
Lost you.
Vimal, we
Wow.
lost you.
I think internet must have.
Yeah, I think Aruna, you can get on. Are you there?
Okay.
Yeah, you're audible.
Well, now it's my pleasure to welcome and introduce our own Honorary Secretary, Mrs. Renuka Prasad. She's an alumnus and life member of American Cancer Society. She has over 25 years of experience working with Indian Cancer Society, which she joined soon after her treatment of breast cancer was over. As Honorary Secretary of ICS Delhi, her core areas of responsibility are cancer awareness, screening, navigation for patients, providing emotional support to the patients, raising funds for their medical aid, looking at their rehabilitation, taking policy decisions and advocacy. She had organized and attended many conferences, seminars in national and international fora. May I request Mrs. Prasad to share your thoughts with all of us and then take this program further. Thank you.
Thank you so much, Aruna. Thank you very much. Well, I feel quite honored to be here in this August gathering, and I'm happy to be here because I really didn't think I would be, because I was planning on a vacation straight away after this, tomorrow itself. So I was just hoping that I'm able to get here for this introductory meeting at least. But thank you so much, Aruna, for your introduction. And it's been a pleasure hearing all the luminaries speak. And it's really heartening to note that we are actually, going into our third year of the FDP. And like Vimal said, that this is a much, much more challenging one than the others. It sure is. Because from the 3 hours, it suddenly become 4 hours. From the normal 5 days, it has become 8 days now. So that means preparing material more becomes quite a problem. But we've also been able to innovate a little. And of course, with Jyotsna's help and her ideas, we put in a full hour of expert talks. So we will be hearing the experts comment on what the teachers are taught, and it would be something more and more enlightening about the area in which the lecture is being provided. So I hope everybody finds it very, very stimulating, and there is more knowledge to be learned, and knowledge, as they say, the more knowledge you have, the more power you have. And I think it is an acknowledged fact that cancer is something that we all need to know about. And of course, the idea that has been mooted by the former UGC chairperson, Mr. Ved Prakash, of including this into the curriculum, at least as a project, or at least somehow or the other getting it down to the people in the academia to learn and know about it more than anything else. It's really the need of the hour, and I laud him for this suggestion. And I'm sure with his connections, he will be able to pull the light strings and get this going. So we look forward to that happening. So actually, when I'm sharing some thoughts, it's just that, these are the tangible results that we have gained over the 2 FDPs that have happened. And these 2 FDPs have spread over 21 states of the country, which means that we are getting towards the entire nook of the country, and people who are even in the remotest areas, especially the ones who are in the areas where it is difficult to reach, that they would be also accessing this faculty development program and getting to learn about it. And the program of the mentor-mentee, where they would be in the second phase, have to mentor 5 to 15 students, means that it will go right into the community level. And we await the feedback that we will get once the whole thing has been compiled, once it's over by about April of next year. We look forward to it being spread over 2 semesters this year, because that is the new education policy that has come about, which specifies that it's not going to be just 1 session this year, but there are 2 sessions because of the 2 semester systems that have come in. So we will be having double the amount of people who are going to be trained in this year. So obviously, we hope the number of the mentees also goes up, and everybody gets to know at least some bit about cancer, and they're able to do some project works which will unify this entire community together, and in a way to be able to reach out to solutions within their area of prevention and early detection. Because it's the early detection which is the keynote, and this can only happen if you yourself are aware of the signs and symptoms of cancer. Because many of the cancers, of course, despite knowing everything, you do not get to know about it because it manifests itself at a rather late stage. But yes, there are some telltale signs which are always there to be able to recognize. And it's easy if you can find out and get to know about it, because that is the crux. If that is done, then let me assure you, there is a life after cancer, and a good, rewarding, fulfilling life that exists there for you. So let there be no obstacles, because we know that there will be doubters, people who will be saying, no, it can't be done. We cannot do this. It's beyond us. We can't reach out to the children. They are not willing to learn, but that's all are the doubters there. But with the hard work, there are no limits. And I'm sure we can achieve whatever we have, started out with, to be able to get to our goals. And of course, what is really, really satisfying is the fact that we have our main headquarters. We have Mr. Hari Mundra right here with us, who has been kind enough to chip in also this year. But of course, like anyone else, it has to be a limited amount. It can never be the entire amount. And we are also going to be chipping in, and we do hope we can able to get some more sponsors, somebody with good deep pockets like we got in the first session through the good offices of our former chairperson, Mr. Noria. So let's hope this year again we can get some more funds to be able to take this beautiful, prestigious project into its further refinement and refinement. I also now would like to introduce to you our team of volunteers and the teachers who are going to be part of the faculty. Dr. Nalini Vimuri, Dr. Priya Parmar, Mrs. Rekha Gulabani, Mrs. Aruna Umat, whom you have all met, Mrs. Minakshi Dhingra, Mrs. Alka Sheel, Dr. Vandana Dhamankar, Mrs. Indira Jasuja, Mrs. Kamna Taneja, Mrs. Sangeeta Malhotra, Mrs. Sandhya Gupta, Mrs. Soumya Rajesh, Mrs. Seema Bajaj, Mrs. Sunita Nagpal, me, and Mrs. Priya Tiwari, who has been working behind the scenes, putting this whole thing together with all the PPTs and everything else that the trainers have been so meticulously planning over the past few weeks. And it's been a tough call for them also, because many of them are duplicating in the seminar also, which follows just after this. This concludes on the 24th, and on the 1st of September, we have our seminar. So many of them are involved in there also in the panels. So trying to cover up those two items together, which are our prestige issues for the Indian Cancer Society, it's a tough call for everyone. But yes, everybody does it. Nobody cribs, and that is the best part. I only wish there was enough time for me to introduce each and every one of them, because many of them are survivors, and most of us have been just housewives, as Jyotsna was saying. But it's just that we've learned on the way, and today we feel we've mastered it. But learning is a process which never stops. It just is a continuous process. And like I said, and like everybody agrees and keeps saying it again and again, that the knowledge is power, and we need to get this knowledge within ourselves and equip ourselves and our families with it first, and then start helping out into the community, which we try and reach as far as we can. We do take this message along to the communities, and we hope, like last year, we would also be in touch with them through the various workshops that they do, the project work that they do, which is very, very encouraging. So we look forward to this also, and we hope that we will be able to deliver a good package this year. I wish many of you could have tuned in to some of the programs that are going to be on. We have our own Aruna here who's going to be taking quite a bit of the sessions alongside. And of course, she having been a principal of a school and a teacher of high repute, as many of them have been, because we have researchers amongst them, we have doctors, we have also not just the plain housewife who's cooking at home, but also the ones who are looking for, beyond the horizon. They're looking for better achievement of better things in life. And this is one of them. And nothing can be more satisfying than community service. Let me tell you that. And when I say this, I say it from the bottom of my heart, because I can give whatever time I have towards it, and I will not be any the poorer for it. But you know that you're on the road to success if you will be willing to do your job, and that to a job that you're not paid for. So that is something that you have to look forward to. And this is why I appeal to all the teachers here who are going to be joining our program to please put in some time into the community service by coming and volunteering with us. Like Vimal said, you all have the wherewithal. So come, help us spread this message of awareness, cancer awareness within the community, going within your own areas maybe, or even coming into the next faculty development program as a teacher out there, and helping to take this further in your field or the area which you feel is the one which you can address in the best manner. So do come forward and do get your students engaged in this mentorship program. And the more you get it, the better it will be for not only them and their families and the community, but the city at large where they live. And this is more so with the tier 2 and the tier 3 cities, which are in the hinterland cities, where access is very difficult. So it will be wonderful for us to also get feedback from you all about the kind of services that you've got there, the health facilities that are in existence, and the other kind of things that are happening there to take this healthcare sector consolidated and make it even better than what it is becoming to be of late. So thank you so much, everybody. Before I close up here, I will now like to call on our chairperson, Mr. Hari Mundra, to come in and deliver his address here. Now, a brief about Mr. Mundra. Actually, it's only a brief. So, Mr. Mundra, there are lots of things of yours, your lovely achievements, which I'll have to just skip, but I cannot do that before I start with exactly where you started off with. As a rank holder in BA Honours and MBA, Mr. Mundra has 50 years of extensive industrial experience, both in India and Indonesia. He began his career in 1971 in Hindustan Lever, and he was the youngest member of its board as the vice president and executive director in charge of exports at the time he left them in 1995. That was really a long span of time. As a management board member of the RPG Group, he was the Group Chief Financial Officer, as well as the President and Chief Executive of Carbon, and the Group Chief Financial Officer, as well as the President and Chief Executive of Carbon Black Business till 2001. In 2002, he joined Wockhardt Group as its Executive Vice Chairman. And in 2003, he became the Deputy Managing Director and Finance Director of SR Oil and was responsible for its resurrection. Post his superannuation, he has been the Senior Advisor to Hospira USA for the Indian acquisitions and the Global Financial Advisor to Wockhardt Group for their turnaround. He has been the visiting professor at IIM Ahmedabad for the last 13 years. Deeply engaged with the social sector, he led the turnaround of Indian Cancer Society and continues as its honorary chairperson. He is also the founder, vice president of another NGO, that is the Society for Complementary Therapies, whom we call upon pretty regularly in our Center for Healing, which is Prashanti. So with that, I would now request Mr. Hari Mundra to please take on and deliver his address.
Thank you, Renaka. as Jyotsna said, I'm impressed by myself, but it is all obsolete. What matters is today and tomorrow. And that is what you bring to the table. So dear friends, actually I should call all of you as our fellow warriors against cancer. And I can see there are about 120 of you who are currently participating in this discourse. From Indian Cancer Society, a warm welcome to this launch of the Faculty Development Program. Actually, I should say the relaunch of the FDP in a more expansive and intensive avatar. The launch had actually taken place on 5th July 2022, when we had 90 participants from the faculty all over India. Now, in the third year, the course has been expanded from 15 hours, as Renuka said, to 30 hours. And a number of outside oncologists have come in as trainers and educators for cancer education. So a big thank you to all the new trainers who have come in. I am also proud to say that we have this year as many as 140 enrollments, up from 90 we had in the first year. And that is really what makes us extremely happy. Now, but before I expand on the theme of the day, let me say a few words about ICS. ICS came into existence to fight cancer in 1951, more than 70 years back. And in the age of disruption and black swan events such as COVID, Ukraine invasion, Hamas, and Israel war, organizations do tend to age and become obsolete and die. But ICS has continued to be alive and kicking even after 70 years and has been at the forefront of fight against cancer. This has been possible due to the spirit of innovation and constant renewal, which are illustrated by a number of firsts which ICS has achieved since inception. First, cytology unit. First, a screening and rehab unit. First, private population-based patient registry. First, survivorship program. First, and the only index journal of cancer. First cancer hospital, Rajiv Gandhi Hospital in Delhi. First use of mutual fund platform to attract donations. In fact, the list goes on. Incidentally, I would like to say that we're very proud now that our experiment with mutual fund vehicle for garnering donations has become a case study at IIM Ahmedabad. Now, the latest innovation has been in the area of cancer awareness and education. Here is a book written by Dr. Richard Frank, a medical oncologist from Connecticut. The title, it is a reverse, but the title is Fighting Cancer with Knowledge and Hope. And this is indeed the vision of ICS, fighting cancer with knowledge and hope, because they reinforce each other and they also, by sharing, multiply and exponentially grow, both knowledge and hope. So this is where India has focused on in this seminar. Now, initially, for the last many years, ICS had been focusing on spreading awareness through mass media, through social media, and so on and so forth. Later, Delhi branch brought in a full-fledged course on this subject for the layperson. It's talking about 15,000 students who have enrolled. We then, 3-4 years back, we extended the education program, cancer education program, to primary general practitioners. You will be surprised that we actually run now video and audio programs for general health care, the GPs, because we found that they also need to understand the contours of this complex disease. FDP is the third leg of our education program, and it started in 2022 under the new education policy 2020. And it has three very powerful components for the benefit of all of you who have joined and have become enrolled here. The first is the digital platform, which comes in the form of, which has made it possible for us to connect with you today. So that is the digital platform. platform which we are using. The second component is the follow-up program, which comes in the form of a knowledge hub called a mobile app, Rise Against Cancer, which was mentioned by Josna and Renuka. This Rise Against Cancer, which is there in 5 languages, ensures that you continuously refresh and renew your knowledge. So this FDP is not the only and the end of the world, because this knowledge which you would get, 90% of it you will forget. And therefore, it is very important that you renew and you continuously retrain yourself. In medical language, it's called continuous medical education, CME. And the third, which should not be forgotten, are the physical branches which we have across India. Mumbai, Delhi, Calcutta, Bangalore, and Nagpur. So that both the click and brick can come together to resolve your issues. So your CME has these 3 components: continuous medical education, the FDP program, which you are attending now, the Rise Against Cancer mobile app, which has been developed for the benefit of everybody. And it has very, very vast amount of knowledge and information embedded. And the third is the branches which we have across the country. So all these 3 come together to provide you what I call the knowledge and hope, and spread it around. Now, before I end, I would like to start with quote Aristotle, 2005 years back. He said that the more we know, mind you, the more we know, the more we realize we don't know. So, and this fits so beautifully and unfortunately to this disease of cancer. The more we know about it, the more we realize that we don't know many things about it. And therefore, in Indian Cancer Society, in this quest of knowledge to fight and conquer cancer, we are not embedded to any particular pathy. We want an integrative approach. We want to take the best of the world and not be restricted to only one pathy, whether it's complementary therapies, whether it's alternative therapies, whatever helps the patient, we are willing to try. And that is the reason why both our app as well as this program deals with things which are outside the medical basket. And we would really believe that we should really not have our minds closed on anything and everything, given that we will always have imperfect knowledge. So friends, I would like to say that you, with the help of these 3-tier program, FDP, the app, mobile app, and the physical branches, you are going to become what I call the life ambassadors for the students. Thank you very much. No, Renuka, you're on silent mode.
Thank you, sir. And I think
Unmute.
Renuka ma'am, you're
Yeah,
mute,
yeah,
please.
Yeah, Vimal, what are you saying? But thank you so much, Mr. Mundra, for your kind words. And it's been really enlightening to put the 3 together that you put in for the general public, to put together the knowledge-based hub that we've created between the app, this FDP, and also our physical branches which are there, where people can come to and seek help at any time. So I now look forward to the next dignitary coming in, and that is Dr. Swaminathan. Dr. Soumya Swaminathan is a word, I think, a person whom all of us have heard of, and we do know because she is quite familiar. She's been very, very familiar to all of us during the COVID, when she was on the center stage, being in the UN, being with the WHO in Geneva, and was conducting the various results of the various vaccines and the other things that had been put up to be able to take this scare of COVID over from the general public. Unfortunately, she has not been able to come personally, but she has sent us a video of hers, which we will be playing once I have just introduced her. She received her MBBS from the Armed Forces Medical College in Pune, and has an MD in Pediatrics from All India Institute of Medical Sciences in New Delhi, where she has been a diploma of the National Board from National Board of Examinations. And as part of her training from 87 to 89, she completed postdoctoral medical fellowships in neonatology and pediatric pulmonology at the Children's Hospital, Los Angeles, USA. And since 92, she joined the National Institute for Research and Tuberculosis and has worked in that field for quite a number of years, after which she took over as the Director General of the Indian Council for Medical Research, more familiarly known to us as the ICMR, and has been the Secretary of the Health Research, Ministry of Health and Family Welfare for the Government of India. From October 2017 to March 19, she was a Deputy Director General of the World Health Organization. And in March 2019, she became the Chief Scientist of the World Health Organization, where she notably participated in regular twice-weekly press briefings on the COVID-19 pandemic. She has urged countries to conduct whole genome sequencing of the SARS-CoV-2 virus more frequently and to upload sequences to the GISAID project. So in preparation for the Global Health Summit hosted by the European Commission and the G20 in May 21, she was a member of the event's high-level scientific panel. So ladies and gentlemen, we have Dr. Soumya Swaminathan for you.
Namaskar and greetings. I'm Dr. Soumya Swaminathan, formerly Chief Scientist of the World Health Organization, currently Chairperson of the MS Swaminathan Research Foundation. Thank you so much for asking me to address you briefly at this faculty development program run by ICS. Firstly, congratulations, because I believe that this is a wonderful initiative regarding raising awareness about cancer and its different risk factors and how to avoid it, how to live a life which is healthy, which includes being cancer free. And also, if one does develop symptoms, then early detection of cancer is extremely important, because then you can have very good outcomes now. So while on the one hand we do see that cancer incidence has been increasing over the last few years, particularly certain types of cancer, and most likely this is related to a few factors. One is that we are living longer. Life expectancy, as it increases, the chances of getting cancer and other non-communicable diseases also rises. But secondly, and perhaps even more importantly, the kind of environmental toxins that and pollutants that we are now exposed to, whether it's in the water, in the food, in the air, all of these actually are definitely having an impact on increasing the risk of cancer. Air pollution, for one, is something that many of us take for granted. It's invisible, and yet it has such negative effects on health, from increasing the risk of childhood pneumonias and mortality to increasing the risk of dementia, diabetes, and also cancers. Similarly, the kind of chemicals, preservatives, pesticides that we now are commonly exposed to, both in fresh food and especially in ultra processed food, also are altering our metabolic pathways, setting up more inflammation within our bodies, and that is driving cellular pathways that will promote cancer. In some cases we understand a lot more about cancer now, and in a few we even have vaccines. For example, we know that the cervical cancer in women, which is caused by the human papilloma virus, as well as liver cancer caused by hepatitis B virus, these are both preventable by vaccination, and therefore these are vaccines that must be made available to everybody. Of course, hepatitis B is already part of the Indian National Immunization Program, and very soon the human papilloma virus vaccine will also be made available to prepubertal girls. The raising of awareness about signs and symptoms, especially of the common cancers, is very important, so that people can go and get screened. Like in the government program, you have screening for oral cancer, breast cancer, cervical cancer, which is part of package of non-communicable diseases. But the other common cancers, of course, are lung, gastrointestinal cancers,
Hello, Vinod.
as well
कोई
as
प्रिया को
prostatic
like मैंने
cancer,
बुला
colon cancer, and so on.
किसी छोटी कोई
Sometimes
बुला
the
छोटी
symptoms
कोई अनुज
can be vague,
तो
but I
अनुज
think
है
having a high index of suspicion is important. This whole approach that you've taken
या
of
से ये पूछ ले कि
training
अब आगे
faculty
क्या होना है
members,
मेरा काम है आगे
teachers in schools, universities, who in turn impart this
मेरे
knowledge
पास प्रोग्राम नहीं
to
है
students, school
हेलो
students and
प्रिया
college
what happens
students, I
now
think is a very good way of getting this message across. I, for one, have seen the power of
who takes on
arming young people with knowledge
Vimal
and
takes
how
on
that can really change things in society.
oh I'm not muted
For example, we know that young people who understand the terrible effects of smoking, they are able to convince their parents to give up smoking when medical counseling may not have achieved the same effect. Similarly, on healthy eating and nutrition, which is again a very important element of staying healthy, is something that we need to really work with young people, because they are the ones who like to experiment and eat different kinds of food, and more eating out, eating processed food and ready to eat food. So there needs to be a balance, because if you're only eating processed food, then that is extremely bad for health and for nutrition. And as young people, you need to build that immunity and have enough strength in bones and muscles to take you through life. So I think the fundamentals of healthy eating, of good nutrition, of the importance of safe drinking water, the importance of taking immunization and vaccinations. A lot of information today comes from social media, particularly for younger people. Some of it is good, but a lot of it is not right. It is incorrect, it is false, it is misleading. And unfortunately, there are many people on social media who are posting things, videos, including celebrities and people who post videos on topics that they don't know that much about, right? So they could be giving very wrong messages. So I think it's important also for young people to know where to get the right information from. Where are the credible and good public health sources of information that you have access to? We had the same issues during COVID. There was so much of vaccine misinformation, so many rumors that were being spread, so much of misinformation. It was confusing people. So it was important for scientists, public health authorities to really speak about the true facts. Of course, there could be unknowns, but then one has to accept where the facts, what we know from the science, and where there is still unknowns, where we still need to do more research. So that kind of transparent communication on science, how science progresses, is extremely important. And so I do wish that this initiative of yours grows from strength to strength, that teachers, students, and the entire community benefits from it, and that we do see a reduction in cancer, or at least an early detection, so that more people can survive cancer with a good quality of life. Thank you very much, and wish you all the best.
Thank you so much, Dr. Swaminathan, for your address. And now I look forward to handing over the mic to Aruna, who will take the event forward with the start of the FDP program. So Aruna, it's all yours.
Thank you. We'll give you participants 15 minutes break, 10 to 15 minutes break. Quickly have your cup of tea so that you are fresh again to take on the course. And I'll meet you exactly at 6 o'clock. Is that okay with everyone? Please don't be late. We have to meet all the deadlines of the modules. Thank you.
So
We'll
thank
see
you
at
so
6.
much, all the dignitaries who have
Thank
joined
you,
us today.
everyone. Thank you.
Thank you.
Don't log out, come within 15 minutes, please. Hi, Nalini, all set? Abhi, you are muted still from the
Yeah.
meeting.
Yeah,
Okay.
yeah. I have, Anu just unmuted me. And yeah, lovely to see all of y'all.
Now
Yeah.
it is ICS show now, so Anuj
yeah.
has all the controls.
Yeah. Okay, sorry, I mistook you for Indra. Hi, Aruna. Yeah. Hi, Indra. Yeah, I have to, I got up at 5:30 this morning.
I
So
know.
I keep on saying good morning to everybody.
That's right.
Yeah.
So
Okay, I'm going to mute myself now.
अभी तो time है about
Yeah.
6-7 minutes.
Yeah.
Nalini,
Hi, ma'am.
how are things with you?
Yeah, fine. And ma'am,
she's-
I told you so many times, please don't call yourselves as housewives. It's so painful.
There's nothing wrong. We've
No,
risen.
ma'am, y'all are all women of substance. I call y'all that.
You say it's
You think housewives are not women of substance?
Yeah, they are. Yeah. But lovely to see all of y'all. And
Are you
please
out of your jet
excuse me
lag?
if I'm looking sleepy. Please
Sorry.
excuse me if I'm looking sleepy.
No,
Don't
because
you
Jyotsna
have-
came last night so late, so he
Yeah,
must be.
I got in at 3 o'clock this morning.
No. Yes, Indraji, only the speakers are going to be unmuted. Otherwise, there is always some confusion. So that's a good thing.
Very nice session this morning.
Yeah.
Thank you to everybody. It was really great.
It causes anxiety only in the beginning, and then when it starts, you go with the flow, to it goes on.
Yes.
थोड़ी देर बाद। Nalini, today I'll take the chat questions. I'll be sitting through after you complete, say, half of it or something. And so next time we'll see what is to be done. Today, Vimal didn't speak about the poll question, no? I didn't hear her saying.
No, she didn't speak about the poll question, but I
Ah.
think she's planning to
No.
address all that in her technical session when she gives all the details. So if she doesn't, then
I'll do that. That's how I'm there.
hello. Hi, Renu. Yeah, you go ahead with your packing. That's okay. Uh, uh. Hmm. So don't do it, and one of us will do it. It's not necessary. Huh. Okay. Yeah, sure. We'll do that. We'll do it. Okay. Yeah. Aruna, can you hear me? Can you hear me? Aruna, yeah, just give me a second. Renu says that she will not be able to. Me?
Anuj? Anuj, are you there?
हाँ जी मैम।
हाँ, इसको ना पहले मैं स्पीकर से बंद करके पूरी स्क्रीन पे ले आओ सबको, so that we know all are there. Then you bring it later, all of us. Even मेरा भी हटा दो।
एक
गैलरी पे ले जाओ। Good evening once again. Will you please switch on your videos for some time so that we know that you are there? Teachers, please. That's it. We want to see your fresh faces, that you are not tired after an hour and a half of the earlier session, listening to everyone. And your cup of tea must have freshened you up. Let me see. Will you please all switch on your videos for a minute? And I request that, from tomorrow onwards, or maybe today, if you are totally tech savvy, that you rename your, like Dell and 8409 iPhone, that doesn't really impress us. At least we should know your names. So I think you all know that at the 3 dots, when you press that, you find at the bottom rename and you put your right names. That will be interesting to see rather than knowing the name of your laptop or whatever, whether it is Dell or HCL or what. So that's my first request to you. By tomorrow, we should all be seeing your names. And then will you please, are you there? Because the black screens don't tell us whether you are actually present in front of your device, or you are still in some corner of your house. Please switch on your videos. I'll request that again. Let it be on this screen only. And when I introduce my fellow speaker, then you only, Anuj, put it there so that we can see their faces. Well, you will be seeing me almost every day in the beginning of the day. So, and I will keep on reminding you that you have to switch on your videos. Okay, before we start the academic session and introduce my fellow colleague to you, allow me to talk to you for just a few minutes, maybe just 2-3 minutes. Are you all aware that we, every day before the academic session, we'll have a poll question? If you are not aware, then let me tell you why we say that we are putting every day a poll question. It will have one simple, very, very simple question with 4 options, and you just have to click one option out of that. This will basically give us a feedback that what we are talking about a particular cancer. Have you ever heard of that cancer, or that some aspect of the cancer we are going to address on that particular day? So this is just for our information, how much you are aware of that particular cancer, which we are going to discuss with you in detail. So, that will only give us a general idea. But before that, I wish to share with you that only we are conducting this. I tell you why ICS is conducting this faculty development program for the 3rd consecutive year. This project is very close to our heart. Through this program, we want to harness the potential of you educators so that to equip the youth under your care with cancer-related knowledge, so that they are able to make informed choices about their own lifestyle. And in the 2nd phase, you're aware that we expect you to join the 2nd phase, which is the teacher-student mentorship program. So along with you in the 2nd phase, you and your students, they spread awareness in the community, so that you know that awareness is the cornerstone of cancer control. So when the students with their project work, field work, and so on, they spread awareness in the community. So then this deadly disease can be prevented to a very large extent, so that they are able to, it can be prevented to a very large extent, because early detection is the right way and the right step towards cancer control. Now we ask you the poll question. Anuj, will you put a poll question, please? Because we have told you why we are doing it, and now we are asking you, what is your purpose of joining this course? A very simple, there's no wrong or right answer. No, not this, not this. Anuj, not this.
Poll questions, GDLC
remove this. Remove this question, please. What is the purpose of your joining the course? Has Priya given you, or FDP team will do it?
Ma'am, FDP team कर रही है मैम इसको ना poll questions को.
Oh, I see. फिर छोड़ो ना इसको, निकाल. ये उनका है question, ये उन्होंने डाला है.
हाँ जी.
Himanshi, are you there? Who
Yes,
is from
ma'am.
this is not the poll question I'm asking. I'm asking the first poll question is, what is the purpose of your joining the faculty development program? Is it there?
Ma'am, this is the first question we have received.
No. This is for the academic session.
Ma'am, we'll check once.
This you remove first.
Removed, ma'am.
हाँ, this you for the time being इसको हटा दीजिए
Yes,
screen से.
ma'am.
इसको share मत करो अभी. Do you have the other one or not? Is Priya Tiwari there? Anuj?
Yes, ma'am.
So, Priya, you haven't sent them the first poll question which I gave you?
Ma'am, we are just checking the drive folder only for the poll question.
Okay,
Just
I'll
give us
wait
only
for.
a few seconds. Yeah. just
Sure,
wait.
sure.
Aruna, get started. Why unnecessarily keep it?
Okay, leave it then if you don't have it, it's okay. But all right, let me now, when we start the academic session. I introduce my colleague, Dr. Nalini Vemuri. Do you have her slide?
I'm going to share it.
Yeah, ye black hatao. Dr. Nalini Vemuri is a PhD in biochemistry by qualification, and she did that from PGI Chandigarh. She was earlier Vice President R&D in pharma company. As a research scientist, she has more than 40 years of research experience in tuberculosis, leprosy, and cancer, and has several research publications in national and international journals. Her keen interest in healthcare issues made her join Indian Cancer Society 8 years back as a volunteer. She has given several cancer awareness talks at different platforms. She's also a member of Ethics Committee of Indian Cancer Society, New Delhi. Right now, she's sitting in Canada, where when she joined the inaugural session, it was 4 p.m. here, and that was 6:30 early morning there. So she's a researcher, and to exchange information on cancer activities in Australia and Canada, she has her two children, one in Australia and one in Canada, which she keeps on visiting them off and on. And there she has visited the Cancer Council in Brisbane, Australia, and Cancer Society in Waterloo, Ontario. So she will be addressing you. She will be taking a module, general module on what is cancer, and she will be talking to you. First of all, she'll put a poll question, and then she will introduce the topic to you. Now you put the poll question if you have one. That's not, they're doing it for the first time. Yeah. So Himanshi, you tell them, what do? They click on the.
Ma'am, yes,
Just
ma'am.
click
There are
on the
four
options,
choices.
please. Just click
Yes.
on the options.
Yes, ma'am.
Wrong lifestyle choice is single choice. Quickly, all of you. Well, I think it's done. 9. It's okay. You end the poll.
Okay.
It's already done. Nalini, that gives you good information. On to you now.
Okay.
You share your screen or whatever.
Yeah.
Priya Tiwari, you're noting down, or it is already recorded, the poll question ke answers.
Yeah. Hello, everybody, and good evening, and welcome to the first session of this FDP program. It was a real treat to listen to stalwarts like Professor Monica, Professor Ved Prakash, Mr. Harimundra, and also my illustrious colleagues, Jyotsna ma'am, Aruna, Renuka, and of course, Professor Vimal. And of course, also I can't, I shouldn't forget Professor Soumya Swaminathan. The underlying message in their talks was that how through education we can win the battle over cancer. So, but just by promoting education, we can control the disease and also help in preventing and leading a very good life. So today's talk is about the building blocks of life and cancer. I have been told that the teachers or the trainees are from different disciplines. So, so I'm going to take this first talk by giving you the basics of cancer. Many of you all are very familiar with some of the terminologies, but I'm going to introduce the various characters in this cancer and take you through, because it's very, very important to know the basic concepts around cancer, because there are a lot of myths and a lot of confusion in trying to understand what exactly cancer is. So the various topics that I'm going to talk about are: what is cancer, and the various types of tumors. What is cancer is where I'm going to spend a lot of time, because that is the crux of the whole session. And the types of tumors, the status of cancer in the world as well as in India. Why is cancer increasing in India? Which I think it has already been touched upon by some of the speakers in the morning session, afternoon session, sorry. Then what are the risk factors around cancer? How can we recognize the symptoms of cancer, and what are the preventive measures that we can take? At the end of it, there will be a questions, and please put your questions in the chat box. And my request to all of you all is, please address the questions only pertaining to the topic that I'm talking on, because there will be a lot of sessions. There will be a special session on breast cancer and all the gynecological cancers, lung cancer, and so on, which will be taken in detail. So please address the questions today only per topic that I'm going to talk on. So we call cancer as the big C. The reason being that many of the people don't want to know what disease they are suffering from. They want to keep it as a secret, or don't want to share it with people. But at the same time, knowing that one has cancer is very frightening and stressful, as was been already told. The various emotions that one goes through is disbelief, that when a person has been leading a very healthy lifestyle, how can I or anybody get cancer? The fear that your life is going to end fast, anxiety about the family, anger about why should it happen to me, and also what am I going to do, how am I going to lead my life in future, and of course a total sadness. Sandra had mentioned that too much information, when somebody has too much information, it is also leads to a lot of confusion. So, but I want to give a slogan that a little knowledge is a dangerous thing. And this was said way back in 70. What is the reason that I'm saying a little knowledge is a dangerous thing? I'm going to now go back in reverse gear and take you all to 1980, 1990. This was at the time when I was doing my research in leprosy. And the government of India, the health ministry, as well as ministries all over the world, were trying to eliminate leprosy. And there was a lot of focus on this particular disease, trying to control it and eliminate the transmission. At that time, a survey was done where the people were asked between two diseases, cancer and leprosy, which they would prefer. You'll be very, very surprised to know that most of the people said that any day we would like to have cancer. The reason being that leprosy is associated with a stigma. You know, the fingers fall off and you get disfigurement, and nobody wants to be associated with this particular disease. And that is because people did not know the merits or the demerits of what is there about cancer, what is there about leprosy. So with little knowledge, it's a very, very dangerous thing. So if one needs to take control of their health and be powerful on everything about your health, knowing about early diagnosis and therefore to recovery is one of the best strategies. Sorry, I want to also go back to the time when I bring back now to 2024, 2022. Now when people are asked between the non-communicable diseases, that is diabetes, heart disease, and cancer, which one would they prefer to have? Any day they'll say diabetes or heart disease. Nobody wants to have cancer. So again, there's a lot of confusion around cancer because all three non-communicable diseases are silent killers. You don't see any signs or symptoms outside. There's no disfigurement. And therefore, I still stand by the statement that a little knowledge is a dangerous thing. Okay, let's start with the topic. How did cancer originate? It's not a new disease. It has been in existence since 3000 BC. It was first described by the ancient Egyptians. When the physicians did an autopsy on a patient, they found that there was a huge mass with veins stretched on all the sides, and it was looking like a crab. But the origin of the word cancer was by the Greek physician Hippocrates, who is also known as the father of medicine. And he used the words karkinos, and also meaning cancer, and carcinoma meaning carcinoma. And you've also seen that the cancer is associated with the zodiac sign as a crab, and that is the reason for that, because right in the beginning, that is what people found, that the cancer was looking like a crab during autopsies. When we look at the definition of cancer from various sites, and that is WHO, you look at ICMR, you look at Cleveland Clinic, and so on, various sites, you find various definitions about cancer. So I'm going to collect all this and put this as about 5 points, each of which I'm going to now dissect and explain to you all, because as I said, I need to explain to you all right from the beginning. So it's a disease which starts anywhere in the body. Why is that such an important sentence? Because whenever you go to the doctor and he says, what do you have? You say you have a viral infection or you have a bacterial infection. And that is restricted. TB, it's restricted to the lungs. If it is hepatitis, it is mostly the liver. If it is malaria, it is by a parasite. So these are specific locations in the body. But cancer is a disease which starts anywhere in the human body. It could be breast, brain, blood, bone, lung, cervix. In the chat box, can you all tell me an organ where you don't find cancer? Please write your answers and we'll take it up later. So this is the reason it's known as a large group of diseases. The most important point is that it is a disease of the cells. So one needs to, when people say you have cancer, it's now known that is also caused by a virus, but that affects only a specific part of the body. It's not the whole body. So it's a disease of the cells that grow uncontrollably. So it spreads to various parts of the body, and that is why. So it's a disease which starts anywhere in the human body. It's a disease of the cells that can spread. And the most important is a disease of the genes. Now, whenever we talk about any character about ourselves, we say, oh, it's a gene I've inherited from my mother. It's a gene I've inherited from my father. So we need to understand what exactly is the meaning of gene. So, and what are the alterations that lead to the cancer? Now, our body, so I'm going to talk about cells first. That is a definition which is about that this cancer is a disease of the cells. So our body is a complex organ system, and cells are the basic building blocks of all living organisms, which all know. We all have studied about that. So when we look at the the evolution of life, life started with the atoms, that is the carbon, hydrogen, and oxygen, and they coalesced together and they formed molecules like amino acids and sugars. They in turn made macromolecules like proteins, lipids, carbohydrates, and nucleic acids. These are all part of the cell. If you dissect the cell, you'll find all these macromolecules, and the cells together have formed tissues. Tissues in turn form organs, organ systems, and therefore the human individual. And the number of cells in an average adult is about 37 trillion, that is 37 with the 10 to the power 12. And below is a picture of the cells. You have cells of various shapes and sizes and all over our body. So we need to understand disease of the cell. So what is happening? So this is on the right, on the left is the structure of the cell, where you can see all the organelles. Mitochondria is the powerhouse of the cells from where you get the energy and the weight. So we are not concentrated on all that. We are concentrating on the nucleus. So every cell in the body is a copy of a single cell. So every cell in the body, it divides to make a daughter cells, and that is why, and so one cell divides into two cells, two daughter cells, and two daughter cells in turn, and so that makes up all the cells in our body. Right in the center, you can see the nucleus, and this is a membrane-bound organelle, and it is the largest organelle in the cell. Why is the nucleus so important? Because it contains all the genetic material. So what do you mean by genetic material? It contains all the codes for making proteins, which are responsible for the structure, for the replication, and all its functions. And all the genetic information is in chromosomes. So here is a picture of the cell. And here are this is the nucleus. And you can see these are the chromosomes. The different color means one is inherited by the father and one is inherited from the mother. So now we try and understand this a little more. What are chromosomes, genes, and DNA? So you can see this is egg-shaped looking structure, that is the chromosomes. There are 23 pairs in the humans, that is we have 46 chromosomes. So what are these chromosomes? These are long strands in the nucleus, as I've shown you. Over here, I've shown you that they are long strands. And when you take out one long strand, you can see over here, it's a long strand. It's all tightly coiled, and that makes a chromosome. And that coil is the DNA. So it's all tightly packed around the chromosomes. So that is a DNA. And the DNA, as you can see on the right, has gene segments. So that is what the DNA is made up of. So chromosomes comprise the DNA, and the DNA has gene segments. So on the left, you can see this is a gene segment, and over here, and here you can see over here, there are the nucleotide bases. So here, the DNA, now what is the DNA made up of? DNA is deoxyribonucleic acid. As I told you, all these are macromolecules in the cells. So DNA is a sequence of nucleotides which are arranged one after the other. So as I told you over here, I've shown you in the picture on this part, these are the nucleotide pairs, adenosine, guanine, cytosine, and thymine. So these are the nucleotides. They are arranged one after the other. And these are the codes. So if it's ATGC, it is a code for making a particular protein. And this is known as a central dogma. So DNA transcribes to RNA, and RNA translates and makes proteins. So nucleotides carry the genetic code. They also carry instructions to make proteins, which are required for the body functions. And there are many genes which also help to control other genes. The structure of the DNA helix, this one, was by James Watson and Francis Crick, 1962. Nucleotide base pairs, the arrangement was by an Indian scientist, Hargobind Khurana, which you all may have heard of. He got the Nobel Prize in 1968 along with other scientists for physiology and medicine. So we know we owe our allegiance to them for giving us the structure of the DNA. So what happens? So cancer is a disease of the cells, and because of gene alteration and mutation. As I told you, this is a picture of the gene, which all the nucleotides. Now, supposing there is a change in the DNA sequence, that is a change in the nucleotides. Please look over here, right in the center. I've changed the sequence. It's ATGC, and now it is TACG. So these changes can happen when the cell is dividing and it's making copies. It can bring about some changes in this. Instead of ATGC continuously, it can change to TAGC and so on. And how does this happen? This happens, we call this as deletion. So let's say ATGC, one ATGC is deleted, or there is a new sequence which is inserted, as you can see on your right, and it can also be substituted. So this is what brings about the gene alteration. And that is what we call it as mutation. So a genetic mutation is a change to your DNA sequence by deleting, inserting, or substituting pieces of your DNA or pieces of your nucleotide, the gene sequence. And this genetic mutations could lead to genetic conditions. So I'll redefine it. Cancer is a disease of the cells and due to genetic mutations or alterations in the gene. I hope that is clear so far. So what causes these genetic changes? There are various factors. Top on the list on the left, you can see it's hereditary. So it is genes. You could have inherited a faulty gene from either the mother or the father, which is shown as X and Y. It could be because of exposure to environment where there are UV radiations and chemicals, which I will be talking in my session on environmental pollution. I will go into details, but just to tell you what are the various factors which bring about the genetic changes. There are also infections, as I told you, human papillomavirus that will be taken in one section. Is also due to tobacco smoking and also cell division. I just want to draw your attention that each of these factors which bring about cancer is going to be taken in various sessions and leading to the various types of diseases. So, okay. So now let's see what are these changes and what is happening to the cells. So here is a difference between normal cells and abnormal cells, which we call as cancer cells. Normal cells grow and multiply through cell division, and they form new cells as the body requires. What do I mean? They grow only when they receive signals and they stop dividing or they die, and that is called as apoptosis or programmed cell death. Here I will give you an example. When we injure our cells, you've seen that the blood flows, and after that it forms a clot. And later, when the clot falls off, you see that there is only a scar. The whole wound has been repaired. So the body sends signals to the cells to start dividing and so to make new cells, because so again, they grow only when they receive signals. And it's very clear that they do not divide continuously. As they grow older, they die, or when it is not required. And that terminology we call is as apoptosis or programmed cell death. Now let's look at on the other side. What do we mean by abnormal cells? Abnormal cells are cells which have changed due to the various factors that I told you. They grow uncontrollably, so they do not have this thing of programmed cell death or apoptosis as normal cells have. So they grow in the absence of signals and divide more than they should. That is, they do not die. And eventually, because of this not following the signals by the body and they continuously dividing, they form an abnormal mass or lump of tissue, which we call as a tumor. Unlike the normal cells, which do not, they just remain in one particular place, abnormal cells can invade the other body organs. So we define tumor as a solid mass of tissue that forms when abnormal cells group together. It's only here that I'm going to call them as abnormal cells because I just wanted to explain to you all the difference between a normal and abnormal cells. But hereafter, I will be calling them as cancer cells. So here is a picture of what a normal cell and a cancer cell looks like. Many of y'all may have seen these cells under the microscope. So the normal cells have specific shapes. And the cancerous cells, if you can see, they are abnormal cells. They have an abnormal shape. And here below, you can see the cancerous cells are multiplying and invading. There are terminologies one should be aware of because it will be used throughout your 8 days of sessions, and that is carcinogenesis or oncogenesis or tumorigenesis. These are all when normal cells are transformed into cancer cells. And as is written below, is characterized by change at the cellular, genetic, and abnormal cell division. So there is I have in your study material, there is a video on carcinogenesis. I want all of you all to have a look at that because that shows very clearly how a normal cell gets converted to a cancer cell. It's very interesting. Let's look at the types of tumors, which y'all, again, many of y'all are familiar with, but I'll go into a little bit of detail of what these various types of cancer tumors are. Again, I'm going to reiterate that these are terminologies which you will be hearing as each of the trainers are going to talk about their specific cancers that they're going to introduce to you. So there are precancerous tumors, non-cancerous or benign tumors, and cancerous or malignant tumors. So what is precancerous? That is cells, they have not become cancerous, but have the potential to become so. Please understand, I like to use, as a scientist, I like to use the word prone. A person is prone to cancer. When people say, oh, if I'm going to use chemicals or cosmetics, am I going to get cancer? No, you are prone to. If you're outside in the sun for a long time, you're prone to cancer. You don't get cancer, you're prone to cancer. So in the precancerous tumors, there is a condition called as solar keratosis. You see in fair-skinned people because they get exposure to the sun. So you see these rough, scaly patches all over the body. And that can, as I said, it can develop into skin cancers. So whenever you see such things, it is better not to neglect it, but show it to the doctor. Don't try putting all sorts of lotions. It is better to spend money, go to the doctor, get sound advice, and go forward. So the other places where we see precancerous tumors is in the cervix, as a result of which people get cervical cancer, women, and you also see it in the oral cavity. What is this oral cavity? Is sometimes in the mouth, you've seen when you eat very fast, you bite your cheek, right? And you see a redness. Many of us, we treat it with whatever gels, oral gels. Sometimes without neglect, it gets a little pus, and that could develop into a cancer. So it is better again to be aware that these could be precancerous. What are benign tumors? They're not really cancerous, but they could be life-threatening. They are localized, they grow very slowly, and they do not spread to nearby tissues. That is the most important point about benign tumors. They're just in one place. Under the microscope, when a pathologist looks, it almost resembles normal cells. So it's always good to show to expert pathologists. They may or may not require treatment. Please, I'm not a medical doctor, but I'm only telling you these are the definitions. They may or may not, because they are not life-threatening. As I told you, they're just localized. Since they have well-defined borders, so surgical removal is an effective treatment, and they do not reoccur. So if left untreated, some benign tumors can grow large and mimic malignant tumors. These are pictures of the benign tumors. You can see a mole on the skin. Now, all of or many of us have moles on the skin. Does not mean that we have to get scared. just have a look to see whether is it growing bigger, it's going itchy, and so on, which I will take in signs and symptoms. So this could be benign. These are benign tumors, moles on the skin, then polyps in the colon, and fibroids in the uterus. What are malignant tumors, which we are all very, very scared of whenever somebody says the cancer is malignant? These are definitely life-threatening. They are not localized. When I say do not possess a capsule, they're not localized. They all look like a bit scattered mass. They grow very, very rapidly. The cells are undifferentiated. That is, you'll see different types of cells. When they do an autopsy and they look at the thing, the cells are all very different. The cells can invade the surrounding tissue. And the treatments for malignancy is surgery, radiation, chemotherapy, or immunotherapy. The most important difference between malignant and benign tumors are that they can reoccur. So even after the cancer mass has been removed, one can get cancer again, and that is called as recurrence. The malignant cells have also the ability to break away and travel through the bloodstream or the lymphatic system and spread to the lymph nodes and distant body parts. I hope you all know where your lymph nodes are. They are in the neck, the groin area, and under the arms. That is why when one goes to the doctor, he generally feels near the neck region, because if the lymph nodes are infected, they get enlarged. So that is your lymph nodes. And the lymphatic system contains lymph, which is a watery liquid, which has all your white blood cells, which fight infection. So the malignant cells have the ability, when I say break away, there's a huge mass, and they can travel through the bloodstream or the lymphatic system to the various parts. And that is called as metastasis. When the malignant cells break away and they exit from the vessels and they travel through the various parts of the body to different locations, it's called as metastatic cancer. And over here, let me see if I can give you this picture a little more. Yeah. So you can see in the bottom, there is a primary tumor. Here is a primary tumor, and it has traveled through the lymphatics or the bloodstream to a different location in the body, and that is called as the metastatic. So you say it has metastasized. So sometimes these things are called as lung metastasis or liver metastasis, because here on the left, I'm showing you here is a primary tumor, primary cancer, and there you have the lung metastasis. And that is generally through metastatic things. Okay. So this shows the picture of how 90% of the cancers are caused when cancer cells break or metastasize. So you can see if a person has breast cancer, there could be metastasis to the brain, bone, liver. If it is in the lungs, it can also metastasize to the bone, liver, brain. So cancer, again, to redefine, it is cancer of the cells which can metastasize to various parts of the body. And that is a property of malignant cells. Now, what are the types of cancers? As was mentioned in the talk by Professor Monica, there are several types of cancers. So there are more than 200 types and subtypes. So then one is according to the location, one is according to the type of cell, and according to the type of tissue. So location, so you will say lungs, organs where the cancers are formed. So we call it as lung cancer, brain cancer. So you know it is localized to the lung, localized to the brain, and so on. According to the cell type, according to the cell that form the cancer, so they are mostly the epithelial cells and the squamous cells. And according to the type of tissue, it's the connective tissues. So there are 9 main types of cancer, but I'm going to just restrict it to 6 main types, which again, you'll hear throughout your talk. So the first one is the carcinomas, which you'll keep on hearing. It's the most common type of cancer. It is caused by the epithelial cells. You know, the epithelials cover your outside surface of the body or internal organs, and they can occur in various organs. And the various types are, which we call them, is called as adenocarcinoma, which can be found in the breast, colon, or prostate. Squamous cell carcinoma, it's in the skin, lungs, or esophagus, and basal cell carcinoma, it's in the skin. So carcinomas are because of epithelial cells. Okay, so what is sarcomas? Sarcomas originate in the soft tissue or connective tissue, so including muscle, tendons, fat, and all. For your convenience, I've given the definitions. Tendon is a tissue, connective tissue, which connects your muscle to the bone. Ligament is bone to bone, and cartilage is a soft padding tissue between the bones. So that is where you'll see the sarcoma. It arises from the type of tissue, and that is the connective tissue. So you have, or the bone, it's called as osteosarcoma. If it's of the cartilage, it's called as chondrosarcoma. If it is in the fat cells, it is called as liposarcoma, and rhabdomyosarcoma, which is in the skeletal muscles. So that is sarcomas. Now, leukemias, which we all everybody gets very scared of. You all must have seen cells under the microscope. So the myriads of cells, most important are the RBCs, the WBCs, and the platelets, which you can see over here in the picture on your right. So, and these all cells, where are they formed? They are formed in the bone marrow, which is your femur bone. You can see it in the bottom of this picture. This is your bone marrow, from where you get all the various types of cells. It is always very important to know when you do a blood test and you see hemoglobin, the levels of hemoglobin, the levels of RBCs and WBCs. The WBCs gives an index of the type of infection, because there are various types of cells, and sometimes the doctor, just by looking at it, he can say, oh, there's a problem, so I think it needs some more investigation. So leukemia is overproduction of abnormal white blood cells which fight infection. There are two types. I won't go into the details, but they're called as lymphocytes and myeloid cells. And these are the various types of leukemias: acute lymphoblastic leukemia, chronic lymphocytic leukemia, acute myeloid leukemia, and chronic myeloid leukemia. These are all, the difference is in the type of, whether it's in the lymphocytes, which fight virus infection, and myeloid cells, which make your antibodies, which we always say, oh, I've got good amount of antibodies. So these come from your myeloid cells, which are in your bone marrow, and which are the WBCs, which we see in our blood circulation and which fight infection. Lymphomas, these are cancers of the lymphatic system. So that is, you have the lymph nodes, the spleen, and the stomach. So there's a picture over here showing the lymph nodes, which is in the neck area. There are two types of lymphomas. Y'all may have heard some of your relatives or somebody says, I've got lymphoma, and it's Hodgkin lymphoma, non-Hodgkin. What's the difference? Don't concentrate so much, but it's the way one differentiates it is by looking at specialized cells. But the main thing of Hodgkin lymphoma is it begins in the neck, chest, or armpits, and it progresses in a predictable way. So it's very easy to diagnose. That is non-Hodgkin's. Non-Hodgkin's, it begins anywhere in the body. That is anywhere. There's a picture over here. I can see in the bottom picture that it's anywhere there are the lymph nodes, and they do not contain specialized cells. So that is lymphomas. Myelomas are, again, they originate in the bone marrow. These are plasma cells which make your antibodies. So the most common one is multiple myeloma, which affects multiple sites in the body. So melanomas are cancers that developed from melanocytes that produce melanin. It is a pigment that gives you the skin color. So melanomas are cancers of the melanin cells, and it is a most dangerous type of skin cancer. So you have cutaneous lymphoma, melanoma, In the woman, people see it in the legs. In the men, it's mostly in the back. You can also have ocular melanoma, which is cancer of the eye. The way one differentiates, or the doctor differentiates, is by the symmetry. So if you have cutaneous melanoma, it is, you look at the asymmetry, whether it's symmetry or asymmetry, whether they have a defined border and what is the color. So that is a melanoma. The other types of cancers are mostly cancer of the brain, then cancer of the spinal cord, and so on, and cancers of the reproductive systems, which I will not go into because these are, again, the ones which I've told you are the most common ones: carcinoma, lymphoma, and sarcomas and melanomas. These are all to do with the various types of cancer which I've introduced you to, the tumor, various types of tumors, and the various types of. Now whenever we talk about diseases, and the government has to make some policies, which we've heard in the talks by the experts, by Professor Monica and Dr. Swami Swaminathan. You've seen that they have used words like incidence of cancer. Oh, the incidence of cancer is very high on this year, and so on. So if government has to make some policies around a disease, or let's say, since we are talking about cancers, it needs numbers. So it needs a number of people who have cancer, the new cases of cancer, and how many people are dying. So accordingly, the Planning Commission, it makes certain policies so that the disease can be curtailed. Now, initially, the government of India used to ask each state to give its numbers. All the numbers were given to ICMR, Indian Council of Medical Research, and they would have a look at the figures. Now, because WHO, which is our watchdog for health, they wanted to bring about a uniformity in the treatment modalities all over the world, the diagnostic procedures, diagnostic tests. So all the data is given to WHO. And there is an organization called International Agency for Research on Cancer. So this gives it, there is a online website. It's an online database, which is called as GloboCan. It stands for Global Cancer Observatory. This was started way back in 2012. And what does GloboCan do? You'll hear this word by every speaker. The GloboCan estimates of breast cancer, lung cancer, cervical cancer, and so on. So please understand, GloboCan is the standard from which you get the estimates of the incidence, the prevalence, the mortality from 185 countries and 36 types of cancer. So GloboCan, I'm going to show you the website of it. Whenever you'll talk about this disease, this is only centering around cancer. If you want to know about the numbers of various diseases, best to go to the WHO website. So to assess the risk and burden of disease in a community, one should know the incidence, the prevalence, mortality, and morbidity. What is incidence? It refers to the new cases being diagnosed over a period of time, and it is expressed per 100,000, which is 1 lakh. So that tells you incident, new cases which are being diagnosed. And prevalence refers to the number of people currently diagnosed with the disease. So let's say you will say the prevalence from 2010 or 2000, we are in 2024, so say 2 years back, the prevalence, total number of people with the disease is prevalence, and incidence are the new cases. Dr. Swami Swaminathan also stressed upon this, that we are looking at the incidence of new cases, incidence of various cancers. So that is incidence, and this is something what one should be should know about. Mortality is the number of deaths that occur in a population, and morbidity is also the state of being unhealthy. These are the words when you talk about statistics, one needs to know. So GloboCan 2022, let's look at the cancer statistics. The incidence in both sexes throughout the world was 19.9 million. And in Asia, it was 9.8 million, right? So 49% of the cancer cases were in Asia. Now, Asia, you know, is a continent. So these are all so they sometimes put it under continents. They also put it according to various countries. And mortality in 2022 was 9.7 million. This is all due to cancer. And here is, I've given you the link for Global Cancer Observatory, IRC, WHO International, and you can get all the figures from this. So these are known as the pie charts. Dr. Swaminathan, when she was the Director General in WHO, gave very excellent talks on COVID in our country, and she was really praised and lauded about it. This is just to show you what are the morbidities in the incidence in males in 2022. You can see in Asia, it was 49%, and mortality was 5 million, right? So this is in males. I'm going to show you what are the diseases. This is in females. Again, just showing you the figures that the incidence in 2022 in females was 9 million, out of which 4.7 million were in Asia. And this is the figure of the mortality. Okay, let's look at the types of cancers. Because I told you, GloboCan collects information of 36 types of cancer. So this is just giving you an index of the types of cancer in males, lung, prostate, colorectal, and so on. And in the females, it is breast, lung, colorectal. I want you to concentrate only on the first four and do a comparison. In males, it is lung. And I think you can understand why it is lung, mostly because of smoking. And in the woman, the highest incidence is in the breast. It's also in the lung in women. But look at if you compare the statistics in the figures, you find it is more in males. In males, it's mostly lung, prostate, and colorectum. And in the females, it's breast, lung, and colorectum. And of course, the cervix. So that gives you index about the various types of cancer, the incidence in males and females in 2022. Next year, we will get GloboCan 2024, and you can do a comparison. And this tells the government of India, are the numbers rising or are they falling? So incidence, as I'm again going to reiterate, it is a number of new cases. So with all the awareness programs in place, all the policy decisions, all the diagnostic procedures, all the treatment modalities, are the incidence of lung cancer in males decreasing? In women, are the cases of breast cancer decreasing or increasing? And so on. This is the incidence and mortality of cancer in India. You can see right from 2020, 2021, 2022, how there was an increase in the incidence, 13.9, 14.2, 14.6. Please understand, these look, for a mathematician, they look like very small numbers, but each, when it is in lakhs, it means a lot. And this also gives you the mortality, how the mortality has been increasing over the years. And according to, and these are the various common sites, which I've already given you an index of. And according to ICMR, 1 in 9 Indians will develop cancer during their lifetime. 1 in 68 men will develop lung cancer, and 1 in 28 men will develop breast cancer. Please understand, these are all projections. You'll have seen that, there is a thing called as census data. The people come round to your house and ask you all about your family, about your job, and so on. All this is compiled and census, and they come to know, and so they do a thing called as projections. And this is all a statistical analysis. So that is, according to ICMR, when they predict this, they say it is also a caution to all the people. These are the incidents in the various Indian states. Kerala has the highest and Punjab is the lowest, but the numbers are increasing. And as I said, the incident rate is 135 per 1 lakh individuals. That's how we give the incidence, the numbers. So whenever you hear these numbers in the newspaper or in the or even in the TV, please understand it is always per 100,000 or 1 lakh. And this is just showing, giving you an incidence rate in the various thing. The numbers don't mean anything, really. You don't have to say, oh, cancer is very high in Kerala. No, it's just showing the incidence. And later, one looks at what are the reasons. And these are the top 5 cancers in India. These are the ones which are in male in lung, oral, prostate, tongue, and stomach. In the female is breast, cervix, ovary, uterine, and lung. So this is the data from ICMR in 2022. I won't go into the details of this. You all can see this very, very carefully later. But you can see pan-India, all the various types of cancer. In the Northeast is esophagus, and what was the reason? In West Bengal is lung and urinary bladder. In the South coastal region is some stomach cancer, and Goa it's colon cancer. Gujarat and Rajasthan is head and neck. In Punjab, it is all the various cancers and so on. You will hear this also from the experts who will be talking after each training session, and they will tell you what is the incidence of these cancers, what is the reason, and what are the steps which are being taken to curtail the disease. Cancer and demography. Demography means population sciences. So demography is study of the social characteristics and statistics of human population. So whenever we talk about any disease, as I told you, the census data tells you a lot. Whether a disease, the incident is high in women, and is it because of a particular reason why it is more in men and less in women, and vice versa. So these are all the demographic characters: gender, education, age, income, ethnicity. So over here, in gender, men are more prone to cancer. Again, as I told you, because of smoking. And more men than women consume alcohol and tobacco products. Whereas in the case of women, are more of the risks of the breast cancer. So in gender, this tells you, it's very interesting when somebody studies on, does a demography, and that can, I'm sure, Professor Vimal will also include this as one of your projects when you do community awareness programs. This is something which is, you get very interesting data. You know, why is a particular cancer in men and not so on. Education. It's a very important, because that is what we are talking now about, educating the masses, educating the public. So in education, the knowledge of risk factors, warning signs, and cancer prevention is higher among mobile phone users. I won't mention the state, but there are places where you know that people say, "Nay, give the mobile only to the men, don't give it to the women," for whatever reason. We won't go into that. So the men know more about the warning signs, know more about the cancer prevention. Women with more than 10 years of schooling are aware of cancers. They have specific risk factors for cervical cancers. They do not know that about this thing. And that is what it is our endeavor to educate the men and women about the various types of cancers. Okay. So age, there is no significant association between age group. People are more aware of cancer if their friend or near relative had it. Income, higher income groups have better chance of treatment. And lung cancer awareness is poor among the low income group. So these are all factors, as I told you. Demography is very interesting, and the amount of data, amount of information which is collected all over India, all over the world, and how the statisticians put this information together and come up with strategies to control a particular disease, which we are right now addressing, cancer. Ethnicity, that is, scheduled tribes are more likely to use tobacco than other castes. Oral cancer is high among the tribal people, as they're economically and socially a marginalized group. ICMR is now giving a lot of funds for working on tribal population, to helping them with the health factors, their growth, their food habits and drink and so on, and educating them. So that is all about ethnicity. So why is cancer on the rise in India? Mainly, the most important thing is cancer is a lifestyle disease. You'll hear this throughout the talks. People will keep on saying when they're talking about nutrition and diet, they will say it's a lifestyle disease. Why? Because of the changes in your dietary lifestyle. It's also increasing because now population, average life expectancy, as Dr. Swaminathan said, the more older people, you'll find more cases of cancers. There's also increased urbanization. There are changes in social reform norms, late marriage and having less children. There are also obesity. Obesity, as you all know, one needs to control that because that is a sure case of that you could be prone. As I said, I like to use that word. You could be prone. It's not that all people who are obese will get cancer, but one needs to be careful. Use of tobacco products and alcohol, pollution. These are all the reasons why cancer is on the rise. It's not rocket science. One knows why there is an increase on any diseases, but right now we are concentrating on cancer. And these are factors which one needs to be aware of. Most important is the dietary lifestyle. It's also on the rise because of improved detection and diagnosis. You know, way back in the 60s, if cancer had to be diagnosed, the biopsy was sent only to one location in the country, and that was Tata Cancer Research, which was in Mumbai. People saw the cells under the microscope. The pathologists were not very well trained. They said, no, I think we need to get a second opinion. So it was sent to the thing. Now we have diagnostic centers in every state and improved. You also now go into molecular diagnosis. So you look at the genes, you look at the various chromosomes, you look at the genetic level, the molecular level. So there are improved detection diagnosis, which we saw at the time of even COVID, the new RT-PCR techniques. So how can we reduce our risks and what are the risks? So there are two types of risk factors, modifiable risk factors and non-modifiable risk factors. Very easy to understand. What are the factors that individuals can change on their own? So by changing their lifestyle, so it gives an opportunity to change your lifestyle, and non-modifiable risk factors are the factors that individuals cannot change, you cannot modify. So one needs to be proactive in always monitoring, mitigating, have regular screening and early detection. This is just the main definition of the risk factors. What are the modifiable risk factors? Tobacco use, yes, you can modify it by quitting smoking. Diet, adopt a healthy diet. Reduce your alcohol consumption. Increase your health activity. Maintain a healthy weight. And protect yourself from sun exposure. So these, at a glance, if you see, these are all factors we can control and take charge of. It's nothing that somebody has to hold our hands and say, hey, don't smoke, don't drink. We know all that. The others are the environmental exposure, which I will be addressing when I talk to you all about environmental pollution. There are infections. These can be modified because early detection, and radiation exposure. Now, these again, radiation exposure, it is for people who go repeatedly for X-rays and CT scan. If you please understand, there are a lot of people who say, oh, I'm not going to get an X-ray done, I may get cancer. No, that's not right? Because these are all low energy radiations. But if it's repeated, please understand, a doctor monitors the amount of radiation that you've been exposed to. What is a non-modifiable risk factor? Age. You can't do anything. The risk of cancer increases with age. Gender, as I told you, men are more prone to prostate cancer and women for breast cancer, although you find breast cancer also in men. But gender, mostly it is cervical cancer. Then family history. You can't change. If your mother, father, uncle, or aunt, somebody had, there was this thing, it increases the risk. So you have a genetic, we call it as a genetic predisposition. And you all may have heard that for women who have had breast cancer, there is a gene called BRCA1, BRCA, we call it as BRCA1, BRCA2. So if your mother or aunt had breast cancer, so these days, what women are doing is they are looking for this particular gene in their daughters or sons and seeing whether this particular had been inherited. There are also genetic syndromes and chronic health, such as inflammatory bowel disease or chronic pancreatitis. Inflammatory bowel disease, IBD, is very common. Again, one needs to be just careful about that. Cancer, signs and symptoms. These are words which we use very, very loosely. Oh, I looked at my signs and symptoms. I have this disease. No, I don't think I have it. No, please understand, signs and symptoms are both different. Symptoms are what is felt by the patient. You say, I think I'm having a symptom of chest congestion. I have. And signs are indicators that are noticed by your doctors, nurses, or the health professionals. So there's a difference between signs and symptoms. Both are crucial in cancer diagnostic. And it's not that people look for only one sign or one symptom. That is why the doctor, you should divulge everything, tell of all, even the simplest of signs and symptoms that you saw, because that helps the doctor in their diagnosis. There are many silent signs of cancer. So if you have a persistent cough, you should be having lung cancer. It could be so many. There's change in bowel habits. It could be, again, I'm saying it could be. So if a person is constipated or something, just observe for 1 or 2 days and then, of course, consult a doctor. Sudden lumps on the body or under the skin, on the mouth or the tongue, or changes in the moles on the skin. As I told you, when you have these moles or you have lumps, you should consult a doctor. And please, for changes in moles, please do not try all homemade remedies, because that is going to either aggravate the situation. Lumps in the mouth, as I told you, or on the tongue, one should be careful and vigilant. Then wounds that do not heal. You generally find there's a change in the immune response. Generally, in diabetics, the wounds take very long to heal, but that does not mean that is going to lead to cancer. But changes in the immune response could also, when your immunity goes down, there are chances of cancer. Difficulty in swallowing, it could be tumor in the neck. Itchy skin, again, I said, could be of the skin cancer. Changes in the urine could be kidney or bladder cancer. Changes in the voice could be laryngeal cancer. Unusual bleeding or discharge in women could be, again, some underlying problems. It could be cervical cancer. Persistent pain anywhere in the body, you should not neglect. And unexplained weight loss or weight gain, so early signs of cancer. So this is, here I want to say that you know your body. Everybody knows their body very well. You don't have to go and tell the doctor, there is a lump and all. And then he will give you a battery of questions. How many days was it itching and all? You know your body. So you see anything unusual in your body, it does not mean it's leading to cancer, but there is something wrong. If it is for 3 days, if it is for 5 days, if it is for a week, should not neglect and consult. So we have caution. All these symptoms have been made into one word, which is easy to remember, and that is caution. So be cautious about the changes in your body. C stands for change in the bowel or bladder habits. This is a very, very common thing. I have seen it even among my own relatives, that if you don't pass stools or you're having this, and just have some curd rice and go to sleep, or have some this thing. No, just be vigilant. A sore that doesn't heal, you have something on your skin, unusual bleeding or discharge in women, thickening or lump, T stands for. I is indigestion or difficulty in swallowing. O is obvious change in the wart or mole. And if there is a nagging cough or hoarseness. So these are, so if you remember the word caution, you can be cautious and vigilant. So these are the preventive measures. What are the do's and don'ts to stay healthy? I put all the do's in red. Very obvious. Exercise regularly, eat healthy, get vaccinated, which again Dr. Swaminathan was talking about. Get vaccinated whenever there are vaccines. Get a regular screening done. And what are the don'ts? Don't smoke. Don't drink too much. Protect yourself from toxic chemicals. Cut back on junk food like pizzas and burgers. It does not mean you should not eat. Do indulge, but not excessive. In the do's, know about your family history. Please be, that is a very, very important thing. Please don't take it lightly. You don't have to go and ask all your mother, father, uncles, aunts are there, but if they have, better to be careful. And of course, in the don'ts, practice safer sex, which you'll hear about in cervical cancer. So this is a definition of cancer screening, the process of checking for cancer or pre-cancerous condition in individuals who do not show any symptoms of the disease. That is the most important. You may not show any, and that is why I say all the NCDs, diabetes is a silent killer. Nobody knows. There's only blood sugar in your blood. That is why you'll find, you tell the maid, she's like, kya hai? It is just a diabetes. It's all right. It's not showing. Cardiac disease, or you get breathless. Cancer, it could be a tumor growing inside, but you just neglect it. These are the goals. Early, before it has spread, when it can be more treatable, and regular cancer screenings and understanding the recommended guidelines for the different types of cancer are crucial for early detection and effective treatment. This is a very profound statement. That is, you should look at the guidelines for the different types of cancer and what are the detection. So these are the screening. I won't go into the detail, but just tell you that all the screening methods are in place. And that is what is the best part about in India is there's so much of economic development in every front, in the infrastructure, in incomes, as well as all the tests. Imagine these, let's say almost 50 years back, all these tests were not in India. So one should make use of this. For breast cancer, mammography is there. There's clinical breast examination, breast self-exam, which y'all will hear tomorrow. What are they will be telling you in detail how to do these things. Clinical is by the healthcare professional, and how a woman can do her self-breast examination. Cervical cancer is Pap test and HPV testing, which are again both in place in India as well as in so many centers. Colorectal cancer, it is on the rise, and one should go for colonoscopy. Fecal occult blood test. I'm right now in Canada, and I understand that the colorectal cancer cases are very high. So every individual after the age of 50 or 60, everybody has to do a stool test because they want to catch colon cancer at the earlier stages. Sadly, in India, we find that colon cancer is on the rise only because of neglect and not being aware. So there's a stool DNA test. It's a very simple test. You just take your own stool, put it in a sterile bag and send it to the thing, and they'll tell you. Lung cancer, CT scan. Prostate cancer, prostate-specific antigen test. There's also a rectal examination. For skin cancer, there's a dermatoscopy. So there is a magnifying device called dermatoscope. I've given you the descriptions. You all can all read it very, very. I don't want to read it for shortage of time. And it's also very self-explanatory. But I just wanted to tell you all that all screening methods for cancer which is the best part about how health has improved in India, how it is now at such a high level. India is looked upon. India was one country which made its own COVID vaccine. So now staying in Canada and meeting all the people over here, I realize the admiration that people have for India, because we have a very good pharma industry, we have a very good diagnostic industry, we have industries making vaccines and drugs and so on. Indian Cancer Society has its own detection center. I just wanted to mention that. You have these is a center where you can go and get your test done either for free or at a very, very low cost. And it is all by specialized male and female doctors. So if you have a blister in your mouth, you can go to them and they'll tell you whether it could be cancer. There is a mobile van which goes to various societies or villages called Asha Kiran. Can you imagine in that van, you have an X-ray machine, you have a mammogram. So all these tests are done by this particular, by Indian Cancer Society. That is our contribution to what we are doing. I'm going to end this talk by just one slogan, that cancer is not only just a curable disease, but an equally preventable one. So the prevention or the cure is in our hands. So if you want to cure this disease, if you do not want to spend lots of money, just tap it at the initial stages, because then it is preventable. What do I mean by it's curable? All the things are in place. The screening methods, the diagnostic procedures, everything is in place. So it can be cured and it can be prevented. Those of y'all who are very fond of reading, these are two books that I recommend for y'all. It's by Siddharth Mukherjee. He stays in USA, but he's got the Pulitzer Prize for The Emperor of All Maladies. This was also converted into a theater play, which was, I think, organized by Indian Cancer Society. So it's a very, very interesting. It's a biography of cancer. And there's also a book, The Song of the Cell. So if y'all have it in your libraries, or y'all should ask your library to get them. These are very interesting books because he, again, like I told you, I took y'all right from the basics of what is cancer, what is it at the gene level, and he's made it very, very simple, and he's made it as a, cancer cell is talking to you. It's a very interesting book. According to him, cancer, we know it could be hereditary, or it could be because of the environment, or it could be triggered by certain factors, or the most important is by chance. What do I mean by that? You're just sitting in one cell. There is an alteration of the gene, which I showed you. There's alteration, deletion, and substitution. Why it happens, nobody knows. But it is just by chance. So when people say, I don't know why cancer happened to me, I've heard this many times, even by taxi drivers or people in the labor class who say, I have not eaten meat, I didn't drink alcohol, I didn't smoke, I had ghar ka khana, all that, I got cancer. Now that is a time when the doctor finds it very difficult to get them, and that is what we call as chance. So this is what cancer is all about. It is could be because of hereditary, environment. Again, as I've told you, these are all the factors that we can take charge of. And by chance, we can't, but we can control it and cure it by being aware and by being vigilant. And now I'll take questions from you all. Thank you.
Stop sharing the screen, Anuj.
No, I'm doing it.
Acha, you were, sorry. Thank you, Nalini. It was a wonderful session.
Thank you.
There are no questions in the chat box, but lot of admiration that it was very informative and interesting, very well done. Yevo. So
Thank you, trainers. I'm very glad that I could make it simple for you all. I'm very passionate about teaching. I'm a research scientist, and I'm always looking for newer ways to teach and give you all information.
In case you have any questions, you can raise your hand and we can probably unmute, or you can write it in the chat box in case you have any questions. But thank you for your admiration otherwise for Nalini, who has delivered this module in a very, very elaborate manner, but still keeping up the time. So anything else you want to mention in the chat box, we are will be happy to.
Yes, I would like questions. If not a question, it's something that you all would like to share, you know. There's a question by Sharad Lakhekar. What are the tests I've already mentioned and the screening, cancer screening? There are several tests that you can do that. What's the difference between a cyst and a cancerous lump? Cyst is something that you will find in the ovaries, and lump is something that could be on the surface of the skin or just below the skin, or a lump somewhere in the breast. So when you have a lump, you generally don't call it as a cyst. Cysts are some more in the internal organs, so those are cysts. Yes, cancer is really curable if it is detected at its very, very early stages. You all know cancer is, you have things as stage 1, 2, 3, 4. So if you recognize it at stage 1, which we neglect, we say, oh, it's all right, I'll go later. So it is curable. I mean, you go and detect it early. And let me tell you, all oncologists, all oncosurgeons, the first thing that they try to do is save your organ. You'll hear it in the session on breast cancer. I think, Aruna, is Dr. Kanchan Kaur coming?
Yes.
Yeah. You all should listen to Dr. Kanchan Kaur on breast cancer. A marvelous speaker, and she will tell you exactly, because breast is a very important and a very valuable organ for every woman. And the first thing she says, I've met her, and she says, the first thing we try to do, even if there's a lump, she said, we try to save the organ. So yes, it is curable, but it depends upon what stage.
Well, participants, I think you will enjoy, interacting with the experts every day, more or less. There is some expert or the other coming, because we are taking it to the next level, the information sharing, knowledge sharing, and the skill. They are the real persons at the scene. We are all volunteers. We have, like you, in education field or some otherwise, and our experiences are also, some of them are the caregivers and the survivors themselves. So they talk from their own experiences also, and we have learned over the years. When we joined, unlike probably Nalini, who was working in the health sector, but a person like me, I'm very similar to what you are, masters of your own subjects, but not really knowing much about cancer. But you do learn it, and it's not that this talk of 1 hour session or something will give you all knowledge about the cancer. It is over the time that you learn it. There is a lot of information available even on the print media, where the doctors share their knowledge, they share their views about different types of cancer. And we, you know how we are learning, we preserve those cuttings, the news cuttings, we read it time and again. Me and Nalini and various other volunteers from Indian Cancer Society had, done some sort of deep research from the very authentic sites, internet sites, from where we compiled the data and compiled it into a volunteer training manual. So it is through your own interest, but yes, don't depend upon just the WhatsApp videos. They are mindless forwards coming off from all corners, but authentic informations are available at very, very authentic sites where you can learn. Vandana, we will talk about the breast cancer in detail tomorrow. So wait for another day and you will learn a lot about breast cancer from one of our volunteers who herself is a breast cancer survivor. And then we have an expert coming. So every day we will have some experts will take you beyond our knowledge about cancer also. So you can learn a lot. But the only thing is you get the information and we forget it the next day. So you have to, read and continue learning. That is the best way of doing it. And when you come into that phase 2 and you talk to your students and you do some project work with them, suggest them, then they also internalize the knowledge which you will be imparting to them. So I think we are coming to the end.
I just want to say, Aruna, 2 points to the trainees. And one is, as you said, yes, please read authentic information. Don't believe the WhatsApp messages. As I said, if you want authentic, just go to ICMR website in India, go to WHO and look at WebMD. I've put a lot of things in your study material. Please look at those. And there's so much you people can do by way of projects. It's not a question of, just listening to lectures. Take it to the community, what you have learned. I always feel that whatever knowledge you have gained, give it back to the society. That's one of the reasons why I joined ICS. I felt that I have done research, I've done conferences, I've done all that. What do I give back to my country? What do I give back to my society? And it is through awareness talks that I have, even if it's 1% of victory, that I made a change in a person's life. That is my victory. And I think that is what we should do, through projects.
I think there's one more very authentic information knowledge you can get is from our e-learning course. We'll put up the link in a day or two. We'll put up a slide and that will remain with you. It is on the SWAM platform and it's a whole lot of module. If you do that and we have given that incentive that if you score 75%, you become a volunteer with Indian Cancer Society. It talks of many aspects of cancer, and we are also touching those, but it is a full course online. You can always join it. We'll share the link with you. Anuj, please remember to prepare a slide about the link about that. And now Himani is here, who is from the technical team. Please invite Vimal or whoever is taking up the next lot of information for the participants. If they have any problem with the mic class, you said that it will be 7:30 to 8. So we leave you at that. The technical team will interact with you if you have any problems, or they will advise you something. So we are not a part of that. So we'll meet you tomorrow. Good night. But please don't log out. You still have half an hour with the technical team. Who is there, Himani or some other?
Shrutika is there. Ma'am, Shrutika is there from GD.
Whoever is there, you are taking on, or Vimal is coming? Who is it?
Ma'am, I'll be taking the session.
Okay. So please carry on. We leave you. Thank you very much.
Aruna, can I leave?
Yes, yes, please do. We are done. Thank you.
Participants, is the screen visible?
Yes, ma'am.
Yes, it's visible.
Okay, sure. I guess there was some microphone issue. Yes, so we'll have a technical session now. And we'll learn about my class, what my class is. So basically, my class is a LMS based model where you will find all the details, where you fill all the materials, study materials, projects, assignments, quizzes, everything you will find on my class. So it is very important to have access to my class. Now, we'll go through the steps to log into my class, where you will be finding all the assignments, quizzes, projects, and all the study materials, day-wise study material, day-wise PPT will be uploaded on my class. Even feedback forms, once feedback forms shared with you on WhatsApp will also be available on my class. So what you have to do is, on any of your browser, you have to write myeclass.academy. It can be written on any of the web browser, be it Chrome, Safari, or Internet Explorer. And whenever you write myclass.academy, you have to click on the first link that appears on your browser, right? So when you click on first link, if this screen will be there, that means you have entered my e-class. If this screen is not visible to you, that means you have entered a wrong link. So please check your link and you have to enter this screen that is like visible on your screen. Now, on the top right corner, you will see an option for login. So you have to click on login and you have to write your credentials over here. We have sent the credentials to your registered mail ID. So please check your registered mail ID that you have received a mail from GAD-TLC regarding my class username and password for 1 week OFDP program on cancer awareness. So your username will be your registered mail ID on which you have received this mail, and the password has been mentioned on your mail. So you have to write that email ID and your password over here and you have to click on login. By chance, if you have not received your mail, please check your spam folder. That mail has been sent to spam folder as well. And then also, if you have not received your password and registered your username and password, or you have forgotten your password, what you can do is you can log in using your account on Google. You have to click on Google and then you can select the account by which you want to access my class. So after accessing my e-class, after adding all the credentials that you have received on your mail, you will see this screen which will ask you to change your password. So you have to, on the first blank, it is asking for your current password. Your current password will be the password that has been sent by us on your mail, and the new password will be created by you. So the new password that you will be creating must be of at least 8 characters, out of which one should be digit, one should be lowercase, one should be uppercase, and one should be a special character. Special character can be at, hash, underscore. It is up to you which special character you are using. But out of those 8 characters, 4 should be these. One should be digit, one should be lowercase, one should be uppercase, and one should be special character. After creating your new password, you have to write your new password again, and you have to click on Save Changes. After clicking on Save Changes, your password will be updated, and for further login, you have to use your new password. So kindly note that the password that has been provided by us on mail will be your one-time password. After login, if you want to log in again and again, you have to use your new password that you have created. One more thing, if you are already a My Class user, you can use your older password that you have to access your My Class. Right? Yes. Now, after login successfully, you will see this screen that is dashboard. To confirm, have you logged in successfully or not? On the top right corner, your name will appear if you have successfully logged into My Class. Now, how will you reach to your course? On the top left corner, you will see 9 dots. With category of courses, you have to click on these dots and you have to click on training and workshops. After clicking on training and workshops, you will see a page where there are many courses available for different FDPs. You have to click on first course that is available with the poster, with the brochure as well. You have to click on OFDP-008 Cancer Awareness. Do not click on the poster. Please click on the written part where it is written as OFDP-008 Cancer Awareness. After clicking on this, you will see this screen where you will find all the materials, not all the materials, but there, if you can see the background over there, and you can enter OFDP-008 Cancer Awareness, that means you have entered to your course successfully. So this is your designation. Here you have to reach. But by chance, sometimes what happens is your screen asks for enrollment key. Please note that this step is completely optional. After clicking on the poster, if you are able to enter this, that means you have reached your course. But by chance, if your screen is asking for an enrollment key, you have to write 0081324. So this is, you have to write on the space provided, and you have to click on enroll me. After that, you will be able to enter this course. Right? If you are not able to access your My Class, you can reach us out on our WhatsApp number 98104-54703. Please note that this number is only available on WhatsApp. We are not available on call. So please don't call on this number. You can text your query on WhatsApp. We'll reply your query. Right. So now I'll show you one demo. This PPT has been shared with you on your mail with your registered mail ID and password. The mail where your registered mail ID and password has been shared, this PPT has been shared with you. We will share this PPT in group as well. So I guess my screen is visible now.
Yes, madam.
Okay.
Yes, ma'am.
Now I'll be starting with the steps that I have already told you. I'll write myclass.academy on my web browser. See, as I am already a user of My Class, so it has directly entered to My Class. So this is a screen we was observing on the PPT, right? On the PDF, we were observing this screen, and now I can see the screen. Also, there is a logo of my class over here. That means I have successfully entered to my e-class. Now, second step was on the top right corner, I'll see an option to log in. I have to click on login. So I'll click on login and I will write my username and password. I'll click on login. See, as I am already a user of my class, this my class is not asking me to change my password, right? So after click on login, your screen will ask you for password change. You have to write your older password that has been shared by us on your mail on the current password, and new password you have to create. So this screen will appear when you write your credentials in over here. So we have skipped this part, right? Now we have to click on 9 dots and category of courses. I've clicked. I will click on training and workshops. Now I scroll down a little. See, cancer awareness, FDP is there. I will click on the written part of cancer awareness. Just wait a minute. It is uploading.
Hello, excuse me, ma'am.
Yes. So, see, I can see the course. So, this is the screen that we were getting on our PPT. So, this is the screen I got after successfully logged into my class. Right? So, that means I have successfully entered my class. So, this is how you have to follow all the steps and you have to reach here. Clear? If you have any doubt, you can unmute yourself and you can ask me.
Hello, madam. Dr. Seema Samrani from Mumbai here.
Yes, ma'am.
Yeah, so I have got the email and I know that my registered email ID is my username and password has been given to me. I did put the password, but it is saying invalid credentials.
Okay, so just wait for today. Do one thing. Just wait for today. Our team will again update all the passwords and you can try tomorrow morning.
Okay, thank you.
Hello, ma'am.
Yes, ma'am.
Ma'am, just 15 days ago, I had logged in my class for RC course. Can I
Yes,
use the same one? Can I use the same one?
Yes, ma'am. You can use the same one.
Okay, thank
I
you.
have given the same mail ID, the same username will be yours, and you can use the same account.
Sure. Okay, ma'am.
Yes, participants, if you're already a user of my class, you can use your existing account that you are using. No need to do all the steps. Your account has already been created in my class and you can use the existing account.
Excuse me, ma'am.
Yes, sir.
एक जगह पे यहाँ पे ये आ रहा है जहाँ पे वो पूछ रहा है डू यू विश टू ज्वाइन एज अ, वहां पे आ रहा है टीचर, स्टूडेंट एंड कोर्स क्रिएटर.
Student.
Okay, thank you.
Yes. So any other participant who has tried and it is showing as invalid login? For any participant, is it showing as invalid login? Seema ma'am, can you share your details on our WhatsApp number? We'll check it once. Showing invalid login. Pooja ma'am? Can you share your details on our WhatsApp number, your name and your registered mail ID? We'll check it. Yes, any other participant who is facing any issue with my class? Participants,
Madam, I am not able to log in because I have already registered, but that email confirmation is error like that coming.
sir, can you repeat?
Because previous year I attended the course, that email ID now presently I log in means that it shows email confirmation is pending like that it coming.
Okay, okay. Sir, you can write your mail to WhatsApp number, we'll check.
Okay, madam. Okay.
Maria ma'am, password has been provided on your registered mail ID. Please check in once. Your username is your registered mail ID and password has been provided by us on your registered mail ID. Please check your spam folder as well because sometimes mail sent by us goes to spam folder. Please check spam folder as well.
Ma'am, is there any assignment posted there already? After
No, sir.
I logged in.
All the assignments will be posted after being instructed during the session.
But
So,
not as of now because I just logged in and there is no assignment. So I was
no,
just.
no, sir. No, nothing has been uploaded yet, sir.
Okay, okay. Thank you.
So by today, you will see day 1 study material by tomorrow on my class and as well as feedback form of day 1. So it is very mandatory that you must log into my class. Pratyasha ma'am, please check your spam folder as well. All the participants, please check your spam folder.
I think I've received. Yeah, thank you. I've received your mail. I just wanted to find out because since I've done my FYP also with you all for a month, so I
Yes, ma'am.
think the pattern of we submitting the assignment would be the same.
Yes, ma'am.
Right?
Yes.
Of getting getting logged into my class and then probably will go into the same pattern which were followed in the FYP. For the FYP,
Yes, ma'am.
right?
On the same course, you have to upload the assignments and
Okay,
quizzes.
I think it has been a very, I think it has been a very supportive team, and thank you all. Thank you so much.
Ma'am, your voice was breaking. Can you repeat?
I said it has been you all have a very supportive team. I laud you for all of you for all of that because whenever we have any query, you get back to all of us very promptly. So any issue that we have, we'll just get back to you. Thank you for your support, of all of you. Thank you.
Suma ma'am will share the feedback form in the group. So participants, please try to log into my class. And
Madam?
if you are facing any issue, yes, ma'am.
I can't find any assignment in that app, madam, myclass.academy.
Participants, we have not uploaded any assignment, any quiz on my class.
Madam, it shows like topic 9. What is the topic 9, madam?
It is nothing. It is just a demo that you are able to see that.
Okay, madam. Thank you.
We have not uploaded anything. Tomorrow, you will see the day 1 material as well as day 1 feedback form on my class.
Okay, madam. Thank you.
Hello, madam. Excuse me, madam.
Yes, sir.
I am not able to log in when I enter my email ID and provided password by yourself. It is telling that your email or password is invalid.
Sir, please note down that there should be no spaces in the mail ID and passwords that you are writing.
Also
Yeah,
the
nothing is there, madam. Nothing is there. Everything is all right.
So check the first letter if it is small or like caps. If you are not able to log in, you can like write your name, your complete name, designation, and your mail ID to our WhatsApp number. We'll check
Okay.
and we'll resolve.
Okay, fine. Thank you.
So all the participants, please try to log in, as it's mandatory to log into my class. You will find all the assignments and everything on my class. We have not uploaded
Hello,
anything on my class yet.
excuse me.
Yes, ma'am.
Ma'am, it's saying your current password is wrong, invalid. Again and again. I have tried many times.
Your current password is wrong. Ma'am,
Hmm.
are you writing caps ECLASS? It is case sensitive. Please try again.
Okay.
Yes, ma'am. We'll share the PPT on WhatsApp group.
So the feedback form has to be filled in today itself, right? For today, we have to fill up the feedback form for today itself, right?
Daily wise feedback form should be filled.
Okay. And the assignment will be given at the end of the session?
Ma'am, it will be instructed during the sessions when to like when feedback form, when assignments will be given, when quizzes will be there.
And what are the, okay. Acha. And will we be given a time span to complete the assignments and get back to you all?
Yes, ma'am.
Okay. It will be like last time then. Thank you so much.
Yes, participants, please log into my class and please confirm if you are able to log in or not.
Seema here again. I could log in with my old password. So
Okay,
thank you. Yeah.
Hello, ma'am, is it cancer fundamentals?
Yes, ma'am. It is this. Are you able to see the screen? Cancer awareness.
Yeah, in that my class, no, I am searching actually. In that Swayam cancer fundamentals, like that one.
No,
Yeah.
ma'am. Please check this cancer awareness. Click on training and workshop. Click on top left corner. You will see 9 dots with category of courses. Click on training and workshops.
Okay. In
And
that
then,
I will get it, no?
Yes. You will
Okay,
scroll
ma'am,
down
thank
a little. The first poster will be of cancer awareness.
Okay, thank you, ma'am.
Welcome. Yes, participants. Nothing has been uploaded on my class yet. Because this is the first session. Slowly, we'll be uploading all the material on my class. So first try to log into my class.
Ma'am, if everything is okay, can we leave?
Yes, ma'am.
Okay, thank you.
Participants, please log into my class as it is mandatory. All the assignments will be uploaded on my class only and will not receive any assignment or quiz through mail or WhatsApp. So you have to log into my class.
I mean, that cancer awareness is there, but I'm unable to log in, ma'am, in the course.
Ma'am, have you received the mail
Code
with
is there,
password?
008 code is there. Hello?
Ma'am, can you share your screen? Hello?
I'm logging in through the mobile actually.
Ma'am, have you received the mail with your password and your username?
Today I attended one RCA. Previously, I have my class. In the
So,
training,
ma'am, have you logged in with your like older password?
direct link, madam, actually that one. I clicked and I entered in the my class only.
Okay. Ma'am, on the top right corner, can you see sign in?
Nine dots are there. No, in that I choose that training and workshops. In that I got that 008 cancer awareness. On that, if I click, no, it's not opening.
Ma'am, what it is asking?
1, 2, 3, 4, like that. It is have the box.
Ma'am, is it showing like this, all the courses?
Not all the courses. It is giving only names, ma'am.
It is giving on names, ma'am. Click on 008 OFDP-008 cancer awareness.
I clicked on that only, ma'am.
Ma'am, what it is showing now?
Showing?
What is it showing now, ma'am?
I'm logging in, ma'am.
Ma'am, first you log in, then you follow all the steps. You will reach the course.
Okay, I will try.
Login is mandatory, ma'am. First login.
Hey Ranju,
Okay.
टैब दे
So
जल्दी इधर.
participants, please try to log into my class. Participants, please try to log into my
I have
class.
logged in. Thank you so much.
Okay, ma'am. We'll have more query sessions from tomorrow. So if you are facing any problem with my class, we'll resolve the query. As well as we have shared our WhatsApp number with you. You can write us on our WhatsApp number as well.
Hello.
Yes, ma'am.
Yes, Dr. Jayshree here.
Yes, ma'am.
I'm not able to log in. It shows that invalid login and please try again.
Ma'am, please write your email ID and your complete name on our WhatsApp number that has been provided in screen.
Sure.
We'll resolve the issue.
Thank you. Thank you. I hope that should I put a personal WhatsApp message or in the group it will be okay?
Ma'am, personal WhatsApp message.
Fine. That's okay. Yeah, thank you.
Hello.
Yeah. Yes, ma'am. Yes, sir.
I have also the same problem, ma'am. After entering the username and given password. Hello.
Yes, sir. Yes, sir. Yes, sir.
It's showing that try after some time.
Try after some time. So, sir, this might be due to that my class has a crowd. Abhi. So you can try after some time. If you are able to log in, then you can confirm. Otherwise, you can drop your complete name and your mail ID with a screenshot of what it is showing to our WhatsApp number.
Okay, ma'am. Yeah, okay. Yes. Okay. Yeah, sorry, ma'am. It's giving invalid login. Please try again.
No issue, sir. You can try again once.
Okay.
Please note that the password and the mail ID should be case sensitive. The my class is case sensitive. So you have to write the exact email ID. There should not be any space. There should not be like any, if you are writing caps A and in mail it is small a. So you have to write small a only.
Okay. No, it's same means I am writing the correct one and the password is also correct one, but it's still showing the same message invalid login. Please try again. And
No
I have
issue,
tried
sir. You
4
can
to
drop.
5 times.
Sir,
Yes.
no issue, sir. You can drop your name and your mail to our WhatsApp number.
Yes, ma'am. Yes. Thank you.
Hello, ma'am.
Yes, sir.
मैम मैंने ये लॉगिन तो कर लिया है. इसके बाद कुछ रजिस्ट्रेशन भी इसमें एक्स्ट्रा कुछ करना है?
कुछ भी नहीं करना है सर, बस आपको वो कोर्स तक पहुंचना है. अगर आप वो कोर्स तक पहुंच गए हैं तो आप सक्सेसफुली लॉग इन कर लिया आपने.
हाँ, तो कोर्स तो इसमें दिख रहा है सब, मतलब ऑप्शन आ रहा है सारे.
हाँ सर, बस सब चीज आपको उसी में दिखेंगी.
ओके मैम, ठीक है.
हाँ जी.
थैंक यू मैम.
यस सुमा मैम, कैन यू अनम्यूट? Please unmute yourself, ma'am. Okay.
Ma'am?
Please unmute your. Yes,
Uh,
ma'am.
I shared you one screenshot now, ma'am. After that, which option we have to select? It is showing cancer. After that, which
Ma'am,
option
you
we
have
have?
no, ma'am. No options need to be selected. You have reached the course. There you have to reach. You will be getting all the materials over there.
Okay,
Nothing to do
directly
now.
it will access, ma'am,
You have
tomorrow.
reached the course.
Okay. Okay, thank you.
Yes. So all the participants who are facing any issue, you can share your query with us on our WhatsApp number. We'll resolve the query. Otherwise, we'll having all query session related to my class tomorrow as well. So you can have your query with you. We'll resolve all your queries. Jai Shri ma'am. Ma'am,
Thank
can
you.
you unmute?
Yeah, sure. Thank you. See, I logged in on my mobile and it shows that like my name is everything is there. And when I click on the 3 lines, it shows dashboard, home, calendar,
Ma'am,
and these are the options, but I'm not able to, create my new password.
ma'am, are you already a user of my class?
No, just I logged in my mobile and it allowed me, but in my laptop, it was the message invalid login. Please try again.
So, ma'am, there might be some issue with the like letters that you have entered. If you are
No.
able to like log into in your mobile, that means you are able to successfully log in.
Well, while I'm using mobile as well as the computer, two device cannot be, access the my class at a time.
Yes, ma'am.
Okay, that may be a reason. Fine. So I have to, but I'm not able to, change my password.
So,
It doesn't
ma'am,
allow me
if you're
to
already
change
a
my
member,
password.
ma'am, if you're already a member of my class, it'll not ask you to change password.
Okay. No, but I
Have
don't
you
want.
used my class earlier as well, ma'am?
Sorry. Yes, ma'am. Hello. Hello.
Ma'am, your voice is breaking.
Yeah, but I am in a Wi-Fi, no worries. Okay, fine. So where
Hello?
I need to go because it doesn't allow me to go anywhere else. I'm on the home page only.
Okay, ma'am. On the home page, can you see on the left there are 9 dots?
Yes.
So, ma'am, click on the 9 dots.
I did it.
And then, ma'am, click on training and workshops.
Fine. Yeah. Yeah, it is done.
After clicking on training and workshops, ma'am, you have to click on OFDP-008 cancer awareness.
Yeah, it is there. Fine.
Click on it, ma'am.
क्लिक नहीं हो रहा है. I'm not क्लिक नहीं हो रहा उसके ऊपर.
मैम जो रिटर्न पार्ट है ना जहाँ पे OFDP-008 लिखा हुआ है उस पे क्लिक करना है.
एक मिनट, मे बी नेटवर्क थोड़ा सा. ओके फाइन. कुछ तो प्रोसेस इज गोइंग ऑन.
It might be loading.
Maybe it is on like my class is having a more load. All the people are working on this, so maybe it's
Yes,
not
ma'am.
so fast.
That's why. So,
Yeah.
ma'am, you can try again after some time. It will show.
Sure, pakka, 100%. Thank you. And after that, I have to log in there. Okay, matlab
Yes.
awareness.
Yes.
What I need to do.
Ma'am, that means if you can see this course, that means you have successfully able to access the course.
Okay. Yeah. Thank you so much. Yeah.
Because, ma'am, we have to read this
I'm able
course.
to see
All
this.
the assignments will be.
And the announcement is blank. under assignment,
Yes, ma'am. Everything.
the topic
Huh.
9. You had.
Nothing has been uploaded, ma'am. Nothing has been uploaded. That's why it is shown as topic 9.
Fine. So it is successfully logged in, right?
Yes, ma'am. Yes,
Thank you.
ma'am. Just you have to remember your password.
Password, whatever the provided by you, because I haven't changed my password. They doesn't allow me. The website doesn't allow me to change my password.
Okay, ma'am. No issues, ma'am. Again, try to log in from your laptop. There might be chances that it will ask you to change your password.
Fine. Otherwise, this password will work fine. Okay, no
It's
issue then.
fine.
Thank you so much. Yeah.
Thank you. So all the participants, please log into my class. You can try after sometimes, as there might be issue with my class as everybody is trying to log in. Or you can try tomorrow. Tomorrow we'll have a query session. So if you are having any issue with login to my class, we'll resolve all your queries tomorrow. So we are ending this session now and we'll resolve all the queries tomorrow. Please try to log into my class by all the steps that we have told you. We'll be sharing the instruction PPT in the group as well. So please try to log in. Thank you, everyone.